All right, guys.
Good morning, Commissioner Khan. Can you give us a sound check, please?
Were you speaking to me again?
No, ma'am. We're just doing a sound check for Commissioner Carnes. Can you give us a sound check, please?
All right, can you hear me?
Yep, we can hear you and see you. Thank you, sir.
All right, okay.
What time is it?
10:01.
10:01. We live? We ready?
Yeah.
All right. I'd like to call the meeting to order. This is the regular meeting of the Fulton County Board of Commissioners. Today is August 5th, 2020, the hour being 10:01. Now, one note here, today's meeting will include public comments and 2 public hearings. If you wish to speak during any of these times, please use the chat or raise your hand feature to be recognized. Madam Clerk, would you call the roll?
Chairman Robert Pitts.
Present?
Commissioner Liz Hausman.
Present.
Commissioner Bob Ellis.
Present.
Commissioner Lee Morris. Commissioner Natalie Hall.
Present.
Vice Chairman Marvin Arrington Jr. Commissioner Joe Carn.
Here.
Mr. Chairman, you have a quorum.
Thank you. Please rise for the invocation followed by the Pledge of Allegiance.
Let us pray. Almighty God, we are grateful for this day, for your grace and mercy upon our lives. We pray now your blessings upon this meeting. We ask now you continue strength and wisdom upon our leaders. It is in your name we humbly pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Madam Clerk.
On page 2, consent agenda.
Now, there are 34 items on the consent agenda, so continue, Madam Clerk.
20-0494, adoption of the consent agenda. All matters listed on the consent agenda are considered routine by the County Commission and will be enacted by one motion. No separate discussion will take place on these items. If discussion of any consent agenda item is desired, the item will be moved to the regular meeting agenda for separate consideration. Mr. Chairman and members of the board, we have items to be removed for separate consideration as requested by Commissioner Hall. First item is on page 3, 20-0499, community development. Request approval of resolution authorizing the execution of 2021-2023 agreements with cities for continued participation in the federal community development block grants. On page 4, 20-500, community development, request approval to enter into an MOU for the provisions of supportive services to ensure stability of self-sufficiency with the use of continuum of care collaborative applicant funding. On page 4, 20-0501, community development, request approval resolution approving the form contract participating lender memorandum of understanding. 20-0502, behavioral health and developmental disabilities, request approval of a MOU and MOU with Fulton County and the Atlanta Fulton County Pre-Arrest Diversion Initiative. 20-0503, behavioral health and developmental disabilities. Request approval to amend an existing contract with Chris 180 20-0504, behavioral health and developmental disabilities. Request approval to amend an existing contract with River Edge. And on page 8, 20-0521, real estate and asset management. Request approval of resolution to declare certain Fulton County owned properties as surplus. And also the last one on page 8 is 20-0522, real estate and asset management. Accept and file the Fulton County Capital Program quarterly update for the period of April 1st through June 30th.
Mr. Chairman, I had one additional item, if possible, to take a little closer look at, if possible.
Okay.
0497,
What page?
page 30497, top of the page.
Carn. All right, 1 for Commissioner Carn and 7 for Commissioner Hall. Any others? All right. I'll entertain a motion to approve the consent agenda as amended.
Move approval.
Second. Let's vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris, Commissioner Hall,
Yes.
Commissioner Arrington,
Yes.
Mr. Carn.
Yes.
Yes.
Okay, the motion passes, 6
Right.
yeas, 0 nays.
Continue.
Okay, on page 9, bottom of page 9, adoption of the regular meeting agenda, 20-0528. Mr. Chairman and members of the board, we have one amendment to move up item 20-0490 on page 17. Sponsored by Chairman Pitts, request approval of a resolution in support of the continuing transition of the Fulton County Board of Health to a fully self-sufficient state entity and for other purposes.
Other items?
Move approval as amended, Mr. Chairman.
All right, motion is to approve as amended. I'll second.
Second.
Commissioner Houseman, Commissioner Ellis.
Yes.
All right, Commissioner Houseman's yes, Ellis yes, Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn.
Yes.
I vote yes.
And the motion passes
Thank you.
unanimously. On page 10, 20-0529, ratification of minutes, recess meeting minutes, June 17th, regular meeting minutes, July 8th, and regular meeting postage in the minutes, July 8th, 2020.
Is there a motion? All right, I'll move approval. Is there a second? Is there a second to approve the minutes?
Second.
I properly moved and seconded. Any questions, corrections? If not, Madam Clerk, let's vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris, Commissioner Hall,
Yes.
Commissioner Arrington,
Yes.
Warren.
And the motion passed. 20-0530, there are no proclamations for presentation today. Public hearings, 20-0531, public comment. Citizens wishing to participate in public comment registered online or can join the Zoom call by filling out a form located on the county website, www.fultoncountyga.gov. Speakers will be granted up to 2 minutes each. The public will not be allowed to yield or donate time to other speakers. The public comment portion of the meeting will not exceed 30 minutes.
All right, anyone sign up to speak?
Good morning. We have 2 public comments. The first public comment, CAPP Hooker notified me that I, Donna Renfro Lawson, was expelled from the Extended Educational Facilities, also known as the FCLS, in January 2020. However, her document does not mention that the LBOT was notified nor does it indicate that the commissioners have any knowledge of the expulsion. My ability to comprehend your failing to not have this information is unimaginable, since employees, county manager, Richard Anderson, and library executive director, Gail Hunter Holloman, have been copied per my understanding. In addition, something yet to be received by the Atlanta City Council was addressed to that body of servants about my inabilities to enter the public libraries and to vote according to the email communication received from CAPP Hooker. I do not believe that the commissioner selected leadership of our library should be aware of that a management has participated in a blurred line process or processes through the commissioner's methodologies. Because of the expulsion, my right to vote has been suppressed. From directives have been ordered that I not enact with any library staff who also worked the last election. Therefore, one of the many problems with my constitutional voting rights has been unfairly tampered with in regards to the options offered for casting a ballot. More specifically, a voting choice is to enter library branches, and even more so in this early voting period than the previous one, which was highly publicized as a fiasco and a shame to Fulton County's beloved residents as well as the world at large. My hope is that you can vet your actions or lack thereof in the point specific matter and against my civil rights as a constituent of Fulton County who has been gifted a loss through your operative measures. I believe that an immediate response directed to my attention should be a clear and doable good trouble action on behalf of all selected, elected, and rejected leaders locally, as well as hopefully voting constituents. That was from Donna Renfro Lawson of Atlanta. The second public comment that we have is from Garland Favorato from Roswell. The comment, Mr. Chairman, thank you for your decades of service to Fulton County. I attended the July 8th meeting and was disturbed by some distorted information presented by your health experts. For example, Mr. Schuster showed a case graph explaining how COVID-19 cases were increasing over time, but he did not show a corresponding mortality graph that would have shown how cases fatalities decrease over the same time period. Likewise, Dr. Paxson referenced University of Washington projections indicating fatalities were expected to greatly increase, but she did not mention fatalities were actually decreasing at the time. I began tracking University of Washington projections when they first released early this year. I immediately found they were dramatically overestimating fatalities by 400 to 500%. In short, University of Washington statistics are invalid for Fulton County and most anywhere else in the country. Commissioners and educators need more accurate and balanced information to assess how best to reopen schools. Johns Hopkins shows the US case fatality rate is one of the lower rates in the world of countries that have already opened schools. Studies by organizations like Children's Health Defense have shown children are largely unaffected by the virus and almost always recover it if infected. I know of no study in the world that has found a student transmitted the virus to a teacher. Fulton schools must provide a blended approach that allows students and parents to decide whether they want their children in school or to learn remotely. If Fulton County is not going to offer students face-to-face education, why should Fulton taxpayers pay such exorbitant tax rates? If Fulton schools remain closed, parents will be forced to send their children to private schools so they can get a quality face-to-face education. Is that really what you want?
15 more seconds. Are you finished?
Yes, sir. Those were the last of our public comments that have been submitted.
Okay. Thank you, Madam Clerk.
Actually, we have 2 people on the line.
2 online, all right. Hello.
Yes, good morning. Good morning, Commission.
We can hear you. Speak up.
Oh, can you hear me now? Is it a little bit better?
Yes.
Okay, good morning. I come to you thanking you for your time and your service once again. I'm representing the victims of the system. And I want to address 2 different items today, or 3 different items particularly, with regard to the Fulton County Jail. The first one is in regard to the book access for the inmates. I just wanted to see if we could have a dialogue about maybe having some kind of creating a contract with the Fulton County Library so we don't have to pay Amazon for purchase of the books, and maybe the Fulton County Library and the Fulton County Jail can have some type of contract where they can rent the books, or they can check the books out, or maybe they can even give the books to the inmates, because that's what is, the Amazon.com is a little bit, the costs have become a little bit exorbitant. Also, for the tablets that are provided by Securus Technologies, the inmates pay $11 monthly for the tablets, but some of the tablets don't work. And so they are told if they report the dysfunctional tablets to Securus, they're going to repair the tablets, but that has not been done. And so we want to address those tablets, those non-working tablets, also at the Fulton County Jail. And the last thing I wanted to see if we could have some type of dialogue, or begin a dialogue regarding a oversight committee for the jail, because none exist. Therefore, the committee will be made up of citizens who address the concerns and complaints, whatever the complaints they have, so that there could be some type of action taken based on the complaints that are made. Right now, there's no action being taken, and there's no committee. So if that doesn't happen, it almost feels like the commission is okay or comfortable with the fox, Ted Jackson, watching over the hen house. I do thank you all for your time once again, and for your service as always. Thank you.
Thank you.
Next speaker is Sheila Michael.
Hi, can you hear me?
Yes.
Yes, ma'am.
Greetings, commissioners, and thank you so much for your service. I represent Victims of the System, a grassroots organization in Fulton County. I come to speak about the Fulton County Jail run by Ted Jackson, which lacks transparency to this commission and the citizens of Fulton County. It financially exploits families and inmates who are disproportionately African American and minorities. Mr. Jackson has a $90 million budget to operate the jail, but Securus, the jail system, is owned by a billionaire, Tom Gross, and who owns the Detroit Pistons. And we feel as citizens, as a billionaire, these calls should be not 18 cents a minute, but 5 cents a minute, or free. Why through a vendor should there be a charge to inmates and family for salt, pepper, ketchup, mayonnaise, mustard, chicken, tuna, because it is not provided as a food item? We cannot understand why the inmates and their families have to pay for pepper and mustard. Meals lack protein and nutrition, where daily fruit and vegetables are not served, and inmates as a result are put on cholesterol medicine, which they were not on prior to being incarcerated. Why? Because the commission is not aware, and we hope that you care enough to know that the inmates should be treated fairly and humanely. You should be called to walk in the inmates and their family shoes, who are already financially strapped because their loved ones are incarcerated. Last, I ask, why do I as a homeowner in South Fulton pay more taxes for a house valued at $100,000 rather than residents in Fayette County who own a house valued at $225,000? Why am I paying more taxes for a lesser value house when I live in Fulton County and get fewer services? The millage rate and services for my money needs to be investigated by this commission. Thank you for the opportunity to speak.
Thank you. Any other speakers? All right, that completes the public comments portion of our agenda. Madam Clerk, continue.
Continuing on page 10, 20-0532, Community Development. Public hearing and request approval of the Department of Community Development's 2020 Analysis of Impediments to Housing, Fair Housing Choice.
All right, this is a public hearing. I'll open the public hearing. Anyone from the public present or online or written in or called in to speak to this matter? Anyone from the public? If not, I will close the public hearing. Is there one? Yes.
Ms. Collins is a staff member from the city of Atlanta. Ms. Collins, if you have any comments at this time.
No, I don't have any comments. I'm here to answer questions on behalf of the city.
Okay, so we will close the public hearing. Mr. Manager, does anyone want to speak briefly about this? No? No. All right, any questions, colleagues, questions? Any questions? No, what's your pleasure? Is there a motion? All right, I'll move approval. Is there a second?
Second.
Second.
All right, properly moved and seconded. Any questions?
Sure, Mr. Chairman.
Commissioner Morris?
I thought we were just doing the public hearing at this point. The issue of the millage rate is a later item on our agenda. We haven't sounded yet. Am I correct on that?
Where are you, Commissioner Morris?
I thought we just finished the public hearing on the millage rate. But
No. No, we're on 0532 dealing with fair housing.
Oh, excuse me.
Okay.
My apologies.
All right, so the motion is to approve. Let's vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris, Commissioner Hall,
Yes.
Commissioner Arrington, Vice Chair Arrington,
Yes.
Commissioner Carn.
Yes.
I vote yes.
And the motion passes 6 yeas, 0 nays.
I continue.
20-0533, Finance, Fiscal Year 2020 General Fund Millage Rate, Public Hearing.
Now, this is a public hearing on the 2020 General Fund millage rate. Anyone from the public to speak?
Any of the meeting attendees, if you wish to speak on this public hearing, please raise your hand or use the chat feature.
Anyone? No one? No one? All right, well, I'll close the public hearing. And Ms. Whitmore?
No, this matter doesn't come up at this time. It comes up later on the
There's
agenda.
no further action. Commissioner Morris, did you have a comment earlier? Commissioner Morris?
No, sir. No comment.
All right, let's continue.
On page 11, County Manager's items under Open and Responsible Government, 20-0534, Presentation of COVID-19 Operational Response Update.
As you're going to begin, Mr. Manager.
Yes, sir.
Followed by your okay.
By our staff.
Yes, sir.
We'll try to make this not a marathon today in terms of our presentation. Let's just begin with the realization that the COVID-19 trends have accelerated. So we'll spend some time on those numbers and their implications. As I've said before, this is not a previous misreading of data and trends, but rather a reality check given new information. A couple of highlights. July accounted for 62% of all of our cases to date. So I think as you see that, it's fairly significant. Hospitalization doubled from 287 to 600, putting pressure on the hospital capacity, and we'll show you what that looks like. Of course, most sobering is the death projection, which now is at 1,133 through October, significantly more than it had been in previous views. We continue to follow a three-pronged strategy, leading with testing, the provision of PPE, and community support. As well, we are focused now on operational stability in the delivery of required services, and we'll talk about that later in the presentation. Most notable, of course, in those required services are elections. And we believe we've had a successful early vote. And now with day of voting for August the 11th, have a good detailed plan, and it's going smoothly. So we anticipate that we will have a successful August the 11th vote. Testing continues to be our strong suit. We're performing over 5,000 tests today, more than double what the Cobb, and Gwinnett are doing, using mobile and fixed sites as we have been doing quite successfully. And we now have improvements in scheduling and turnaround times that Dr. Paxton will talk about. And again, this terrific partnership that we established with CORE. I think this is something that no city could have accomplished on their own, and would also say that the Board of Health and Emergency Management could not have accomplished independently. So it truly has been a team effort, and one that has served our citizens extraordinarily well, with a special kudos to both Joe Bearswain and Dr. Holland for their tireless efforts, along obviously with Dr. Paxton and Matt and the entire team. The second part of our strategy has been personal protective equipment. It's now been received, and we have commitments going forward through our strategic partnership with 3M that allow us to begin distribution of personal protective equipment to our 14 cities. We are reaching out to them, and Matt will talk about how we set the monthly allotment for each and how that process will begin. I want to thank Matt, Tim, and Felicia for their efforts in this area, which I think, again, set a standard for others. The third prong, of course, is community support, which this board was an early leader on, and with the $5 million that you approved in the last session for digital skills training, that program continues to move along well, and Dr. Rochelle has shepherded this $21 million program, I think, very successfully across our entire county, serving citizens. As the duration looks to be longer and deeper, we pulled together in the interim during July all the citizen-facing units, tax commissioner, court clerk, and probate court, where you do see citizens still having to come to our facilities, potentially standing in lines, and we are doing everything possible to both lessen the lines as well as look at any changes in rules or adjustments in procedures that would eliminate coming here altogether. Anna Roach will review, I think, a very good discussion that we had with all three heads of those offices, the elected officials, and what items that can be worked on going forward to further improve that experience. As well, we keep a close eye on the Fulton County Jail. As you know, that has been something that we've paid an enormous amount of attention to, and the Sheriff's Department have done a great job in managing that environment from a COVID perspective. But we do have a number of cases that have spiked now, so Alton will review the plans that are established with NAFCARE, the Sheriff's Department, and our staff to mitigate that spike. We continue to manage the CARES funds strategically and with an eye to impact and execution by 12/31. As you know, we have 90 million or so of that 104 million committed and 30 million now expended, which, by the way, also led all of the counties in Georgia reporting in the last round of reporting. We also have received 1.8 million in expense reimbursement requests from our cities, and Sharon will overview those and how that process will work. In addition, what we are now thinking about looking forward, given these trends, is obviously an event that's longer in duration. And we will bring back at the next board meeting for your consideration perspectives on hazardous pay as well as child care support. And there are new federal guidelines around hazardous pay that actually narrow the ability or narrow the type of employee and job that will qualify. So we'll discuss that in the next meeting. In addition, thinking through that, we really continue to believe that we should be conservative in our financial management. And as we prepare for the 2021 budget process, we really, and obviously with the setting of the millage rate today, I think that less is more needs to be the guide. In other words, the focus will be on operational stability, preserving some of our funds to offset the loss of CARES funds going forward, rather than looking for enhancements to previous budgets. And we'll need to confront a huge disruption if over now a year or more period of time in areas like senior services, library services, and art services, and those implications due to the duration. So we'll be prepared to discuss those items, Mr. Chairman and commissioners, in the next meeting. Okay. So again, we'll step through in the same way that we have traditionally done this, setting the stage with the numbers, Anna's introduction, moving through those, then getting into the discussion on reopening, then the CARES funds, and again, hopefully do so quickly. Okay. So I'll turn it over to Ms. Roach.
All right, Madam COO, and then after each presenter. Let's hold our questions, please, as always, until the presenter has concluded his or her remarks. Madam COO, you with us?
Good morning, Mr. Chairman and members of the board. No opening remarks. I'd like to kick it directly over to Mr. Meyer, who will, after his presentation, introduce Dr. Paxton. And following Dr. Paxton's presentation is when we will open for questions from the board. We'd like to do our best during this presentation to focus on questioning from the board. So we will try to march through the slides fairly quickly and leave ample time for questioning. Matt?
Thank you, Mr. Manager. Thank you, Madam COO. Good morning, Board of Commissioners. Thank you for the opportunity today. We're going to go ahead and start off with the dashboard. Doug is going to run us through just some of the highlights since we last met, and then from there go into a little more details, and we'll round it off with some discussions about PP, and then finally getting to our sample collections and handing the baton to Dr. Paxton to bring us home. Doug?
Good morning. We thought it was important to summarize what's happened through the month of July. As you've seen many stories on the news, and it's been a while since we've presented to this group. So what you see in front of you are some kind of milestones for the month. In July, all cases for Fulton County, 62% of cases that were identified for the entire event happened in the month of July. March through June, Fulton County averaged 75 new cases a day, and in July, we averaged 375 new cases a day. COVID-19 deaths, it's a lagging indicator, generally 2 to 2.5 weeks after a case surge, and we did see that in the second half of July. Also, as you'll see, our most probable projected death rate has grown from 557 to 1,133. Hospitalizations doubled in July from 287 to 600. Available hospital bed and CCU bed space reached critical levels during the month of July, and we're still there. Testing. We did double our testing in the month of July from approximately 2,250 a day to over 5,500. The test positivity rate also grew in July from about 5% to over 15%. So pretty significant changes for the month of July. Next slide. We put a lot of information on one slide here. We think it's important to look at things side by side. Please realize that these are daily numbers, not cumulative numbers, and we track the trends with a 7-day trend on these slides. To the far left in the green, you see our testing. As you can see, the testing, we've had a high of 7,038 in the month of July, but we have kind of plateaued at about a 5,200 mark over the last 2 weeks or so, and we're hoping that we're meeting demands at that point. We do have the capability to test up to 8,500 a day. The next in the orange is the Fulton County daily cases with a 7-day trend line. As you can see, as I talked about on the earlier slide, in the first couple months, we were averaging about 75 cases a day, and now the new normal. It looks like we've reached a slight plateau over the last 2 weeks or so, but it's an unhealthy plateau of about 375 a day. The next one over is in blue, and that's our COVID bed census for all the hospitals in the county. So you can see the sharp incline through the month of July to a high of 600 about 11 days ago. And we'll talk more about hospital space later, but that is once again an unhealthy number for our hospitals to maintain bed space. Lastly, you'll see the cumulative deaths on a daily, daily deaths. The cumulative average over time is 2.97. In the last 7 days, we're at 3.86. So you can see kind of that lagging indicator that I talked about as deaths have begun to rise about 2 weeks after the case rise. Next slide. So there's a lot to digest here. I think if I explain it, you'll understand. The blue bars at the bottom of this are non-COVID patients. The orange bar that sits on top are COVID patients, and then the green bar is available beds. We established early on as a planning function that anything below 15% was going to be critical, and that some hospitals at that point were going to be on diversion. So we tracked it very closely every day and report out. So one thing I want to bring up here is you can see on this chart that it looks like a wave kind of at the bottom as hospital patients are discharged over the weekend at a pretty high rate. And so we have better bed availability over the weekend. But through the week, you'll see the numbers in red at the top are below that 15% threshold, and which caused the Piedmont to open some beds, actually, that happened early this week, and then yesterday the opening of 60 beds at the World Congress Center because of monitoring these factors. Next slide. So we're in a little bit worse shape in the critical care unit beds. And as you can see, we've been in a red, same basic metrics here. The non-COVID beds are in blue, the COVID beds are in orange, and then the open bed rate is in the green, or the open beds. And we've been below 15% since the 17th of July. Two factors here. Hospitals are seeing a lot more acute care patients that are even non-COVID, as patients have put off going to the hospital, as some hospitals have reported to us. And then also, there is a critical care bed nurse shortage, staffing problem that has led to, not being able to expand as fast. But Piedmont Hospital is giving us more critical care beds, and there will be a slight critical care bed capability at the Georgia World Congress Center. Next slide. So this is a very important chart. It's real-time data, daily data, once again, with a 7-day average on it. And what you see, we'll start with the bottom of the slide first, is the overnight percent positives gathered from the 11 or 12 area hospitals. And as you can see, there was a rise late June through July up to over 15%. And then there has been a little bit of a leveling off. What I do want to, the hospitals test approximately 2,200 people a day, and it's been the same for about 21 days. So the demand at the hospital has been very steady. So with that number being steady, it's I think it makes these numbers even more valuable as a group to look at. So you can see we've been up to over 15% within the hospital, and we're down to about 11% now. If you look at the top of the chart, we kind of track hospitals, our CVS testing sites, our SPOCs, the core testing, and then the state's positive test rate. And then we take all that information, come up with these are all cumulative numbers since the beginning of tracking. If the numbers are in black, they've been steady for a couple days within 1/10. If it's red, it has gone up. And if it's green, it has gone down for a couple consecutive days. So while the state is green, it's only gone down very little, but they had been in a constant raise. So anyway, we think this is very important to monitor. It's a real-time metric that we use. Next slide. This is the death projection. It says IHME model. We do look at about 6 models and compare, and they all are very closely aligned. So 2 things, the worst case scenario death is really high, but we have never, since we've been tracking this, been really above the orange line, somewhere between the orange and the green. But they do, the latest metrics that they've been posting have been calling the most probable line deaths most probable with mandatory mask mandates. And that's 1,133 by November 1st. That's without mandatory mask mandates, excuse me, that's the orange line. And then with mandatory universal mask mandates, 647 is the projection. And then we went over 400 yesterday deaths for the first time. So with that, I'd like to turn it over to Matt in the next slide.
Next slide, please. So we have found one of the three pillars that we were talking about when we first started this whole response was to make sure that we could pursue, procure, and maintain a 9-month cache of personal protective equipment. We are finally there. We're very proud to go ahead and say the combined work of many different departments, our Chief Procurement Officer and her team, our Deputy Director of DREAM, Tim Diamond, as well as the folks that we have here in the Emergency Operations Center, we're able to go and get to this point that we are now ready to distribute this personal protective equipment to our municipal partners. I cannot stress enough, we wrote a memo to all of our elected officials telling them how we were able to leverage our collective purchasing power. There is no way that we would have received the items that we have currently in our cache without making sure that we bought together. 4.8 million surgical masks, over 1 million N95, 25 million gloves. The way we were able to get to the front of the line, the way we were able to go and negotiate incredible pricing is because of our collective purchasing power. I cannot state that enough. So we're really grateful that we're able to go ahead and do that for the municipal partners that we serve. Strategic partnerships, you'll see 2 up there, 3M. I have to thank my Deputy Chief Operating Officer of Public Safety as well as our county manager. They leveraged their private sector relationships. They got us an audience with 3M. We were able to go ahead and turn that into an allocation plan and a strategic partnership, and we are now getting 3M quality N95 masks to go ahead and support our municipal partners that are being put into harm's way caring for individuals that are COVID positive. So we thank both of them for using those relationships to get there. I also want to go thank their Chief Procurement Officer who worked with Grady Healthcare Systems to develop a strategic partnership with Owens & Minor, who actually is within our jurisdiction on Fulton Industrial Boulevard. And we now have a relationship with them who's helping us also with N95 masks as well as gloves. So cannot go ahead and stress these 2 partners helping us get to this final goal line to be accomplishing this. We've talked about this before, just wanted to go ahead and review some of the things that you see on the screen. Over $9.43 million is what we've been leveraging to go ahead and accomplish this mission. What's in the cache? We have 2 buckets that we've talked about in the past for the municipal partners. Non-public safety individuals, surgical masks and nitrile gloves, and our public safety partners. And inside their cache is surgical masks, nitrile gloves, N95 masks, face shields, gowns, and hand sanitizers. One of the other things that we, as you can tell, a part of the maintaining the cache is actually receiving this at a climate control warehouse that was repurposed for this purpose. The county manager is able to locate us a property that we then turn into our climate control facility that is being used to receive all these, to go ahead and categorize them and then further break them down to distribute to our partners. So this is one of the successes that we have had. We've had to go ahead and augment our staff to accomplish this mission, and it has been a really great voyage thus far to get to this point. Next slide, please. Allocation. Just wanted to get you all spun up as to how we got to where we are with the numbers that we're sharing with our partners. Each one of our municipal partners have been shared what their allocations are going to be based upon a 30-day and a 90-day allocation, as well as a 9-month allocation, so they can start planning for that as well. We actually went and our team looked at what would be the typical items that will be used by a non-public safety employee that is interacting with the public on a general basis. So they went with surgical masks and gloves. What we determined when a typical employee would go through in a day would be 1 surgical mask and 5 sets of gloves per employee, and that's what we built our numbers off of. When they came to the public safety cache, we actually used 2 different ways to get to our final number. One, we looked at what all the items that our public safety partners requested for the Federal Strategic National Stockpile. And we also submitted them a survey, and we said, please go ahead and show us in a 30-day period what was your burn rate of the different items that you utilized during your response. We took those 2 items, we came together, we put together planning assumptions with that, and we developed what a 9-month, a 90-day, and a 30-day allocation would look like, and we shared that with those municipalities as well. Also, we went ahead and doubled our planning assumption numbers. We felt like maybe some jurisdictions may have underreported their burn rates. We wanted to make sure that we had enough for them. So all the numbers were actually doubled when we came up with our final allocation for those different municipalities. Next slide, please. I'm proud to say that we are now at the point that we have distributed, or we are in the process of distributing this week, the first 30-day allotment to all of our municipal partners. So far, we actually have had on Tuesday, the city of Hateville and Alpharetta have received their product. Today, Sandy Springs, Roswell, and Johns Creek, receiving their PPE. On Thursday, College Park, East Point, Union City, Fairburn, Chattahoochee Hills, and Palmetto were receiving their allotment. And on Friday will be the city of South Fulton. We're still working with the city of Mountain Park to get their product to them. That'll be sometime either this week or the beginning of next week. Only 2 cities did indicate to us that they did not have a climate-controlled facility to go ahead and receive their full 30-day allotment. That's the city of Roswell and the city of South Fulton. So we're working with them to get as many of their product for the 30-day allotment that they can actually handle in the climate control facility. As you can see on the screen, one of the things that we told all of our partners is if you cannot keep it in a climate-controlled site, allow us the opportunity to go ahead and do that for you. The last thing we want to do is to go ahead and damage any of these critical personal protective equipment because they're not controlled in a controlled environment. I also just want to remind everyone that they will have a one-time allocation to all these 14 municipalities of 5,000 reusable masks that came from the Department of Health and Human Services. We are hoping that these municipalities can then take these masks and get it to the Fulton County residents in their jurisdiction that needed the most. So that's another partnership that we're really grateful for. So very proud of where we are today. It's been a lot of work to get us to this point, and I know that this is going to help our municipal partners be more successful as we continue to respond to this COVID-19 event. Doug, next slide, please.
Yes, before we turn it over to Dr. Paxton, we just want to give you some good numbers that we have on testing. Today, we'll go over 400,000 tests for the county. Like I said, we have very strong numbers through the CORE and SPOC partnership. And using the MS Dynamic system, we're doing incredible work. Next slide. This just shows where we are in relationship to the state testing, who's at 1.6 million. And we're doing approximately 25% of the state's total. And then the county by county of some of our neighboring counties. And really, we're almost between the 4 counties doing about 50% of the state's testing totals. But Fulton County, because of the hard work of all involved, has done quite the lion's share of the load there at 394, 645. So, Matt.
Next slide. I just want to personally thank my team who's been working tirelessly to get to this point. You heard Joe Bereswain's name a couple times by the county manager. He's working tirelessly at our warehouse as well as our North Spock operation to make sure that we're successful there. We also have our team in the Emergency Operations Center that has been working tirelessly as well. So I just want to say thank you to everyone, as well as to our Board of Health partners, have been working side by side with us throughout this whole process. And I'd like to pass this baton on to Dr. Paxton. We'll remain on the line and be able to answer questions together. Dr. Paxton.
Thank you. Can I have the first slide? I'll try also to keep to time and so that we can progress rather quickly. So basically the health update that I have to present today is that, as has been shown in the previous slides, testing and cases are surging across the entire state and most of the nation. However, since our very last meeting, we've implemented almost all the measures that I spoke about at our last meeting, and they have resulted in a marked improvement in both appointment availability, scheduling, and the provision of results to clients. So specifically, as you remember, the last time we spoke, I repeatedly used the word slammed, which was true, because we were receiving at the call center about 1,500 calls a day. And since then, we have, as I said we would, have installed more lines. have assigned more personnel to those lines, and then we established that dedicated line for results. The MSD system was stood up, so clients can now schedule their own appointments. And as a result of all this, the call volume has come down and the call wait times have come down. In addition, most of the laboratories have decreased their turnaround times. As you remember, the last time that we spoke, our turnaround times were frankly horrendous. Anywhere from like 7 to up to 14 days was not uncommon. However, with all of the improvements that have been put in, our average result availability time is now down to, actually, I should have put 2 to 4 days. Many people get their results in as early as 2 days from the time after the time of testing. The LabCorp issue, which had been our primary lab, but which no longer is we've switched over to the Georgia Public Health Labs, and we'll be switching over even more to Mako. They have finally worked through their backlog of that 9,000 tests that I referred to at that time. The Department of Public Health has signed a contract with Mako Labs that is going to result in additional test kit availability for the Fulton County Board of Health. I think as recognition of the stellar job that we've been doing, of the 10,000 tests that Mako Lab, DPH has for Mako, that'll be 10,000 tests per day. They are assigning to Fulton County 3,530. So essentially, they're giving us a third of their tests for our one county in recognition of the volume that we've had. What has not been mentioned is that, but you might have read about it in the press, is that HHS and the White House Task Force have designated Atlanta as a hotspot, and they contacted DPH and the Fulton County Board of Health to conduct a time-limited testing surge, a SPOC, which is going to be located at the airport and will be starting operations for 12 days, starting up on Monday. And through our wonderful collaboration with Matt and his crew, they have been helping with the selection of these grounds and with setting it up with HHS. And it is anticipated that this site will be able to do up to 5,000 or perhaps more tests per day. What will remain to be seen is whether or not actually they will get that amount of people who will be using them. But I wanted to make you aware of this at airport SPOC, which will be set up very soon. The MOU with the City of Atlanta has been submitted and is just going through the final process from the City of Atlanta side. We expect the release of funds to the Board of Health by sometime in mid-August. The scope of the covered activities will be COVID testing, enhanced case and contact investigation, and resource coordination of social services that would allow cases and contacts to be able to maintain required quarantine. The Board of Health Operations, these things change so, we have to respond so rapidly that actually this slide is already a little bit outdated. But I can report that, all the clinics are now open and we are incrementally ramping up our services as our patient volume is increasing. The board and I want to call attention to the fact that our board chairman is here, Mr. Jack Harden, and they approved a resolution to declare racism a public health crisis, and it was formally approved by the board on July 22nd. And I'd be happy to furnish you with copies of that resolution or explain a little bit more about that. The other thing is that, we will be conducting, this is not on the slide, but next week, we're going to be conducting an extensive, a large meeting with at least 97 churches and other faith-based organizations to basically bring them up to speed on the status of the COVID-19 epidemic here in Fulton, but specifically to work with them that ensuring that their congregations and their services and all that remain safe. And so we intend to work with them to furnish them with masks that we have, and also making it clear that we are a resource for them to help them in anything that they would need to help with their for mitigation of COVID transmission among their congregation. Because as you may or may not be aware, in other districts, there have been numerous outbreaks associated with congregations, and we want to avoid that in Fulton. So we're being very proactive about that. In addition, what's not on the slide is that the governor's executive order just came out again. Not much changed from the previous order. It was really just extended. We recognize that having open bars and restaurants has still been an issue in terms of increased transmission. So we're being very proactive, and we are reaching out to certain bars to make sure that they are complying with directives. And we heard, for example, of upcoming circuit party that will be taking place in Atlanta. And so we are reaching out proactively to the organizers of that to make sure that they are able to mitigate any potential COVID transmission. May I have the next slide, please? All right, so I put this slide in because this is a question that people ask me literally every day. So I thought I would put it up because this is one of the first studies that's come out that actually shows about what the effect is of generalized community use of masks. This was just briefly, this was a study that was conducted by the University of Iowa. And they looked at that time at the 15 states in the District of Columbia that had mandated public mask use when out in public. And they looked at the 3-day increments before the onsets of the mandate, and then 3-day increments after these mandates were put in place. And as you can see from both the graphs that are up there, that in the line down the center is the period when the mandates were ordered, and you see that for each 3-day period after the mandates were put in, you see that there's been a marked decrease in both cases, which you see on the left, and also in the daily average death rates. And these continued, throughout while they were looking at until they had to censor the data at 40+ days so that they could write this paper. So the take-home point from this is that community mask wearing prevented both infections and death. And then there's the reference to what was presented at the last meeting about the projected gross domestic product savings of a national mask mandate. So I believe that's all that I have on my slides, and I kind of hurried through those, and I recognize that. So I'm certainly, when you're ready, I'm open for questions and giving any more information that's needed. Thank you.
Thank you very much, Dr. Paxton. Colleagues, questions? Are there questions or comments?
I have a question. This is Commissioner Hall.
Commissioner Hall, you have the floor.
My question is for Matt Kallmeyer, and great presentation, Matt and team and Dr. Paxton. My question is, Matt mentioned the storing of PPEs and that an actual location was found to help us be able to store the PPEs. Where is that location? Hello?
Sorry, ma'am, I was trying to mute the line. I apologize.
No
if you don't mind, I would love to go ahead and if you want to find that location out, I can discuss it with you and your team offline. I really do not want to put the address out in the open public because of the critical nature of the resources that are stored there. I don't really want the address to be put out in the open public, ma'am.
Okay, no problem at all. If that's not a problem with our open records law.
It doesn't violate the open records law because of the fact that we have, it's an emergency provision, and we don't disclose locations of emergency, anything that could cause any damage to the whole county or the state if we were holding things for the state too.
Thank you for explaining that to our viewing and listening public. Matt, you can contact me or my chief of staff with that information. Thanks so much.
Yes, ma'am.
All right, other questions or comments?
I have a few.
Mr. Karn, you have the floor.
Let me get back here. Okay, there we go. Well, first of all, Dick, thanks so much. Dr. Paxton, Joe Bereswain, you guys are doing a great job here supporting us. Dr. Holland as well. I really appreciate it. Couple of questions. When will this airport site be set up? And have we reached out to the College Park mayor?
I'll also, and Matt can chime in on this as well, but I understand it will be starting on Monday.
Monday?
Yes,
Okay.
Monday.
Let's make sure we reach out to the mayor to let, if they, do you know if they're aware?
It's still in the earlier stages of actually working through all the logistics aspects of this activation. It is a combination of resources that come from the federal government, as well as a lot of resources that's being expected from the state and local. Regretfully, at this time, between our team and the Board of Health team, we're at a point of critical staffing levels that we're supporting the locations that we are currently doing. So the state is stepping in to provide additional staff members. Some of the staff members are going to be based upon National Guard's activation or continuation of their orders. So we're waiting to see where that turns out on Friday. There may be a delay if they do not have the orders redone. So allow us to go ahead and see where we get to on Friday and make sure the necessary notifications are made. But we are working with all of our municipal partners to make sure that they're aware that this thing will be going on Hartsfield-Jackson's property in that location. Okay, thank you. And I'm glad to see that our PPE for our municipalities are going out. I was assuming that some of that had gone out a month ago or 2 months ago, but I'm glad to see we're getting it out. My office has been distributing. We've been in the trenches here out in the community, and things are getting, it's really intense out here. People are in need of a lot of help. We're in need of additional PPE, of course. Dick, we've exhausted that 5,000, and we're definitely in need of more. I don't think you guys realize the look on a person's face when they get that packet of masks, because again, it could literally save a life. Certainly, it's kept hundreds, probably thousands of people in my area from getting sick or contracting this thing. So we do need another round there. Our cities, this 1.8 million that they asked for out of the 2.5, this money I think really needs to be expedited as soon as possible to them. We've got the money from the federal government. I heard something along the lines of as late as October before those cities actually see that money. They're all strained for their budgets right now. Their revenues aren't coming in and they're hurting, and they need that money now. If we can give it to them now, that would be great. They didn't even, exhaust the 2.5 million that we had there. If we could get that money to them a whole lot sooner, I think it would make our relationships a whole lot better with our cities. And quite frankly, I don't see any reason why, us being that we have this federal money we were given, not to get them that 1.8 million a whole lot sooner than September or October. I would love for them to get it this month. So if there's any way possible we can expedite that money out to them, let's just go on and put some money in their hands. Because again, even according to the U.S. Treasury Department, their feel was that up to 45% of that funding should go towards our cities. I know most of you all read the article from Mayor Vince Williams talking about the way we've done things as opposed to the other 4 counties that have gotten CARES Act funding. And I honestly don't think our cities have been treated the way that they would probably have liked to have been treated. I think we could do a little better job in making sure we cover them a little faster and a little more thoroughly. 5,000 masks, I hear is the drop dead limit that a city would get. I thought I heard that. I'm hoping that
they can get more if they need more. Obviously, any city with 80,000 people, 100,000 people may need more than 5,000 masks. And I know we don't have, unexhaustible resources, but I want to get a bigger percentage, a bigger piece of the funding that we have to our cities. I think our cities deserve it. And again, 99% of our county are cities. And I just think we owe it to them to try to do a little bit more in terms of funding directly to the cities, looking at that, the monies that we have. So I've talked about that before, and I just want to reiterate that again. Overall, I think we're doing a great job, though. But we definitely want to do better there. Again, back to our staffs on the commission. Some of our staffs are out here in the trenches working pretty hard. Now, being that our federal qualifications for COVID-19 have been narrowed, like I just heard, our offices are still in need of support. Now, I was told that apparently there was a chunk of our office operating budgets that was removed for COVID-19 funds. I've gotten numbers from $3,500 to $7,000 or $8,000 being removed from our office budgets for COVID expenses, I'm assuming. I don't know how many offices have expedited COVID monies on COVID projects and COVID needs, but I know my office certainly has. My thinking is that I believe that money should not come out of our office budget, but should come out of part of the CARES Act funding, because we have specific activities that we did not budget for or expect to have to do in light of without this pandemic occurring. I've had to purchase some masks, a nominal amount, maybe $1,500 to $2,000 worth of masks out of my office budget, which I'd like to be reimbursed out of CARES Act funding. Obviously these are things that we wouldn't have to do, that we didn't plan for in our commission offices as well. So if you all could see your way through to make sure we get reimbursed, we don't want that money coming out of our office budgets, but we'd like it coming out of, if it's an appropriate CARES Act or coronavirus event that we had or purchased, I'd like it to come out of that proper pot of money, as opposed to what little I have left in my operating budget. We certainly do need it to take us through the end of the year. So I don't know if that's the case or how much was taken out, but obviously I'd like that replenished. But I would like any expenditures we had, I would like it to come out of the CARES Act funding money as opposed to out of our office budget money. Because again, it was a coronavirus expense. We've had several, not a whole lot, but we've had a significant amount of money for coronavirus expenditures. So Dick and Sharon, if y'all could take a look at that for me, I would certainly appreciate it. So that's all I have.
The other question.
I know it wasn't a question to me, but I just wanted to make sure that I did have a chance to clarify. So on page 12 of the PowerPoint, we did talk about the 5,000 reusable masks that are going to each of the municipalities. And if memory serves me correct, I believe 8 of the municipalities that you serve, sir, will get 5,000 apiece. So that's a 40,000 additional reusable masks will go into your district. So I think that's a good starting point, and look forward to go ahead and continue to support those municipalities.
Absolutely.
This is Commissioner Hall. For one, I have to, Matt just referenced the page in the presentation, correct? Is that correct?
Yes, ma'am.
Okay, well, the problem is that we did not get a copy of the presentation, so there's no way for me to flip back and check that page. And this is a problem that we've had over the past several meetings, that we're not getting the presentation before the meeting. So if you could please get us the presentation so that we can follow through, especially when we're sitting in our offices or our homes trying to follow this process. Second, I want to go back to what Commissioner Carn just stated about money being removed from the Board of Commissioners accounts. I was told that $8,593 was restricted from the District 4 office budget account and put into a separate unit and held. I cannot find an email or a memo communicating any of this to at least me in my office prior to the removal of this funding. And I can find no such account that it was told to me that we're supposed to have. I also pulled several of the resolutions that I was referred to, like this one, 11-0471, and the minutes for 20-295, and I've combed through all this stuff, and I can find nothing that says that the Board of Commissioners gave the county manager the authority to just go into our district office budget accounts and remove money and place it in a restricted account, or what is being called a separate unit. When I read through all of this, there is nothing that says any of that was done. So I'm a little confused as well, Commissioner Carn. So I'm glad you brought that up.
All right, let's do this. Mr. Manager, Ms. Whitmore, would you and possibly the county attorney get with Commissioner Carn and Commissioner Hall to explain what this is? I've never heard of this, but whatever it, I'm sure there's an explanation for it, but I
I
don't
don't
want
need another explanation. I have emails. I had my chief of staff email our Madam County Attorney about this, and I have pulled the information that she's referenced for review. I've also looked through my most current budget, which is the July budget, to see to find this so-called COVID-19. What was it called? COVID-19 line item, and there's no such line item in my district office budget. So I've pulled all the reference documentation that was supposed to show me where the Board of Commissioners gave this type of permission to the county manager, and I see nothing in any of this. Read every document, I have everything right here. And so I don't need anyone, I need someone to explain to me exactly where they think it is, because I don't see it.
All right, so asking is the manager and the chief financial officer, and maybe the county attorney, to explain what happened. I don't want to take the time from Commissioner, not Commissioner, but Dr. Paxton's time. They need an explanation. I never heard of this before. Would y'all get with them and explain?
We will.
Thank you.
Other questions for Dr. Paxton?
I have a question, please.
Mr. Houseman, please, you have the floor.
Yes, first of all, great news on the PPE allocations to the cities. I'm sure they're very pleased to get that resource. I too I was unaware of it until this morning, until we see these documents. So I would just ask that when things like this occur with our cities, that the Board of Commissioners gets notified of that, so that we can, especially in light of the fact that there seems to still be issues with their perception of what sort of support they've gotten from the CARES funding. So anything that we do for the cities, please let us know, because we talk to them a lot, and I think it would just help smooth over some ruffled feathers, if you will, that we're aware of everything that's happening in that regard. You mentioned the 5,000 masks per cities that was sent, among other things. How was that determined? You know, we've got lots of varying populations in our cities, so 5,000 may be a lot to some cities and barely a drop in the bucket to others. So can someone just speak to that, please?
Ma'am, that was just a purely taking the amount of cities that's covered underneath our program and just dividing it equally amongst them. If there's anything left over, we'll be glad to go ahead and share it with any other municipality that needs more. We did also reserve 5,000 for each commissioner. So far, a couple of commissioners' offices have taken advantage of that. We can definitely go ahead and make sure that your staff gets your allocation if you have not done so yet. I'll have to check with the team on that one. Dr. Paxton does also have an allocation of masks from the Health and Human Services that she's pushing out as well. So our whole goal is to get these out to as many of the critical parts of our community as possible. So I personally, for the ones that we have been allocating are leaning very heavily on our municipal partners to make the proper decisions as to what the most impacted part of their communities are and get those masks out to them. We have been sharing with them our heat maps and other information that we're using to direct the mobile units, the mobile Spock units out there on a daily basis, so they're aware of where those hot pockets are within their communities as well, ma'am.
Well, and I appreciate that. Again, this just makes me want to point out that 5,000 masks in Mountain Park is more than their population. But then their neighbor in Sandy Springs or Roswell, you know, it's not that case at all. So, and then thank you for the 5,000 masks. I was not even aware that I'd been allocated that. So I apologize for not knowing that, and I'll make sure that they get out into the community.
If your team did not know, ma'am, that I'll take the responsibility of making sure that your team was not aware. So I do apologize for that, ma'am.
I recognize y'all have a lot of folks you need to communicate with. I'm just, you know, asking that we can be of help if we know that what's going on.
Yes, ma'am.
Other questions, comments, commissioners?
Mr. Chair, I've got 2 or 3 quick things.
All right, Commissioner Ellis, you have the floor.
I have a request on the reporting we're doing on the epidemiology reports. I know that our Fulton County school system specifically, and I think a lot of the school systems are moving toward this, they're establishing gating mechanisms or gating figures, generally utilizing the cases per 100,000. In the way we do our reporting right now, we've got that in the last 14 days, I think is what they're using. And the way we do the reporting right now, it's in there by city. It's not really clear. It's hard to find or hard to identify what the countywide number is. And then given the Fulton County school system operates outside the city of Atlanta, it's certainly very hard to figure out, you know, a figure Fulton County X Atlanta. So my request would be that we establish in those reports a line item that shows Fulton County as a whole, Fulton County X Atlanta, and then North and South Fulton, so that metric, cases per 100,000 for the past 14 days, since a lot of folks are going to be looking at that. You know, I think it's number one, it's people are going to be looking for it, they're asking for it. And number two, I think it's certainly a great target, you know, for everybody to be aiming for. So that's my request on that. And then just a question on the just verification of this on the test, and I guess you know, for the listening public on this, the test in the hospital, I would presume that they're testing not only, you know, they're testing their personnel and they're testing individuals that are there, and I imagine before people are released, they're doing multiple tests to determine if they continue to be positive or negative. Each time a test is given, regardless of whether it was 4 tests for one individual or whatever, it counts in these numbers as an individual, you know, case count, right? Not, and if it were deemed to be positive 4 times, that counts in these case counts as 4 cases, correct?
May I just interject something? It is actually not the policy to retest if, like, in the hospitals or if someone has a positive test, because they can remain positive for as long as maybe 3 months afterwards. So that's not the policy. We should not be getting a lot of multiple retests of one person.
Okay. Are they retesting their staff?
Positives? No. I mean, they shouldn't. That holds for all people who are positive. I can't speak to how many of their staff are included in their testing numbers. I'm just addressing the retesting issue. That should not be addressed.
But people, if they are retested and they have a second positive, it's 2 cases in the reporting.
Yes, we don't have the ability to discriminate.
Yeah, okay. Whether the extent to which that's going on, we can't verify, but if it does occur, it's two cases.
Yes.
Okay, thank you.
Hi, this is Commissioner Hall.
Commissioner Hall, you have the floor.
Okay, so there was an email sent from a constituent of Chattahoochee Hills. It was sent to our customer service email and all of the commissioners saying Chattahoochee Hills is one of 15 cities in Fulton County. Why isn't it included in the Fulton County Board of Health epidemiology reports on COVID-19 as are the 14 other cities.
Dr. Paxton, if I may, I know that is something that Wendy and I found out, and they're working with the EPI team to go ahead and address that, Commissioner Hall. A lot of the reports come by zip code, and regretfully, the city of Chattahoochee Hills and the city of Palmetto share a zip code. So they're looking at ways that they could go ahead and divide that based upon municipal boundaries. But at this time, the information is being reported by zip code. We did ask for the short term if that could just be an asterisk on the report that showcases that particular zip code includes the city of Palmetto as well as the city of Chattahoochee Hills. But they're working really closely with our GIS team to figure out once again how to further delineate that information. Great question though, ma'am.
Okay, so my chief of staff is going to reply to this constituent and copy you and your backup person and Dr. Paxton and her backup person so that you can respond to his question and just give him information on what to look for next.
Yes, ma'am.
All right, thank you so much, Matt.
Yes, ma'am.
Other questions or comments, commissioners? Yes, Mr. Carn?
I just want to mention again, we thank you for the allotments that we're getting with the cities. That's very good news. Again, I'm in need of more than another 5,000 to distribute. We were at Jackson Memorial yesterday with Pastor Sutton, and we distributed hundreds upon hundreds of face masks where they had long lines for COVID-19 testing. They had two different driveway lines for it. So there was, it seemed like half of Southwest Atlanta showed up to get tested. And again, they were so grateful to get those masks. We've exhausted those, and I am in need of more masks. And we're out just about every week at 2 or 3 events, trying to cover as many folks as we can in all of the various communities. So again, Dick, I know when we talked about me getting that allotment that you would work on to see if we could get some more in as needed. And we're at as needed. If you look at that heat map, District 6 has got a lot of heat on it. So we definitely need a little more if we can get some more.
Anyone else? Anyone else? All right, thank you very much, Dr. Paxton. Madam COO.
Thank you, Mr. Chairman. Next slide, please. Next slide. Commissioners, the performance indicators associated with our gating criteria are unchanged since the last time we presented to you. As it relates to cases, we haven't seen the downward trajectory in the 7-day average that we're looking for to change the indicator on that gating criteria. And with respect to testing, as was covered by Dr. Paxton, we've seen a great deal of improvement in the number of days it takes for the county to report results. And so we're looking for both some consistency as well as additional improvement in that area. The Board of Health team is working very hard toward that end, but we're waiting for a little bit more consistency before changing our testing indicator to green. Next slide. As a result of the gating criteria indicators, you may recall at the last meeting, commissioners, that we did revert our reopening plan back to our phase 1 reopening, which primarily focuses on essential services and prioritizes telework as a way to deliver the remainder of our services that are non-essential. So we thought it would be a good use of our time today to review three of our key business lines, tax services, probate services, and the services of the clerk of the Superior and Magistrate Court. I think the county manager alluded to this in his remarks. We had an extensive conversation with the leadership of those 3 business lines on Friday, talked through what's going on with their employee base, addressed things that were going on with their operations, talked about adjustments that have been made to their operations to to accommodate our environment. And then most importantly, talked through a little bit of any policy adjustments, innovation, or changes that were either underway or that we could pursue in order to address some of the challenges that we are seeing. Many of those challenges have showed up in emails and communications to you, commissioners. And so we wanted to make sure that we had that important conversation and tried to put some things on the table to help address things like long lines and wait times that you've heard about in correspondences from constituents. So I'd like to start with our tax services, and really it was focused on the operations of the tax commissioner's office, not the tax assessor's office. So wanted to make that distinction up front. What we saw with the tax commissioner's office is to date, they're reporting approximately 8 positive employees within their operations. Part of the difficulty that Dr. Ferdinand expressed to us was that there was a huge disruption in the operation whenever there is an experience of a positive. And so he is looking for a way to staff so that he has a cache of employees that can pick up the operation that has been impacted pretty much the next day. When we talked through whether or not we could leverage disengaged employees in other areas of the county to support that operation, the thought was that the level of training and the certification required to do that work would be too extensive for us to use that option. So we're exploring other things. In terms of operations, pretty much all of the functions of the tax commissioner's offices are back in function. The largest business volume that they're experiencing and the source of many of the lines and complaints that we've heard so far is motor vehicle services. Over the last week or so, we've seen those lines reduce, which has been good as they worked through that backlog. But that certainly was a pain point for constituents previously. One of the things that Dr. Ferdinand wanted to highlight was the fact that he has a good and significant level of customer adoption of the payment kiosks that are located across the county using private and public partnerships in locations such as Kroger, as well as a huge level of customer adoption for online options for payment and services. So that was positive coming out of that conversation. Some of the adjustments that have been made that you may or may not be aware of is that consistent with the City of Atlanta's reopening plan and also in response to some positive employees, the 141 and Greenbrier tax offices are closed and they're operating out of the other locations. And some of the adjustments that he requested and we are working toward accommodating is same day cleaning when there's been a positive employee within his operation. That will allow him to get back in service sooner rather than later. The tax commissioner has requested and we have made preparations to extend the provision of tents and chairs as a customer service measure in certain locations. That has proven very helpful when lines have built up outside of the office, and it also assists with facilitating social distancing as well. The tax commissioner plans to explore as well a shift model where he has less individuals exposed to each other from a staffing standpoint. So we'll see how that adjustment works out as it gets implemented. Some of the longer term improvements and things that we discussed pursuing was legislation for an online application or facilitation of the clean air waiver for seniors. As it stands right now, seniors have to appear in person at the tax commissioner's office to accomplish that. The tax commissioner would like to work with our lobbyists and the legislature to see if we can move to an online version of that service. We also talked about drive-through service and the number of bank locations that have closed over the last several years and that are there empty. And so I believe the tax commissioner and his staff plan to pursue leasing or acquiring those locations to see how much of the tax commissioner services could be located within those banks so that we could facilitate drive-through and contactless services. One of the other things that Glenn Melendez, our CIO, is working on at the request of the tax commissioner is specific technology that would support his management staff in operating in a remote or telework environment. I think there's an openness and a willingness to move to that model, but Dr. Ferdinand and his team would like to make sure that they have the proper tools in place in order to facilitate that kind of work environment. And so we're working on that with him. Next slide, please. So far, I am pleased to report, I think we all are pleased to know that the probate court, which has a huge amount of public-facing services in its operation, they have reported 0 positive employees within their operation. So we are all going to be saying a prayer and crossing our fingers that that continues and that department continues that good fortune. They too are at this point saying that they are not able to leverage additional staff that we could provide from other areas that are not operating at full capacity. However, the chief probate judge did say that she would do some more thinking about that and see whether or not there are opportunities for additional employees to assist with any staffing or delay or backlog challenges that they have within the probate court operations. They too are operating all functions that the court is required to carry out. Their single most significant source of backlog lines and complaints are weapons carry permits. And one of the challenges Judge Toomer talked about was the fact that the process does not only involve actions from her office, that she, in the application process, had to work through and depend on the fingerprinting system, which is done by local law enforcement offices, et cetera. So multiple components of that particular service has resulted in a bunch of delays, as well as the backlog from the office being closed for some time. The probate court has switched to a Zoom version of their hearings. I did ask for clarification as to what specific hearings were being conducted via Zoom. I'm waiting to hear back from the chief judge. But then they're also putting the responsibility of line management on the sheriff's department, which they feel like is helping the situation, and that's going very well. The chief judge also talked about exploring with her colleagues across the state, pursuing a law change for some portion of the weapons permit process to occur online, so that would limit the interaction that customers would have to have with the system. So we will continue to support her and whatever she needs in that effort, and we look forward to see how that comes together with the help of our external affairs office. The other thing that the chief judge would like to explore, and we'd like to assist her with that, is an appointment system for locations, or some sort of notification for constituents, so that rather than standing in line, they can wait their turn in line at either in their cars or at a different location and come when their appointed time is there. So appointment system or some kind of waiting system is probably the most significant improvement that we could put in place right now for constituents with respect to the delays in probate court. Next slide. And finally, commissioners, we had a long discussion again with the clerk. It was a very productive discussion with her and her team. Unfortunately, their operation has experienced 10 known positive employees, and again, huge adjustments when that is discovered. DREAM gets kicked into action for cleaning protocols. The human resources office is engaged to make sure that employees know what is available to them if they are positive. But again, through the contact tracing process, a positive employee within any department will lead to a huge disruption in service and a shortage in staff. So we continue to have in place protective equipment that will, as much as we can, prevent the spread of the disease within each of those operations. Because most of the employees within the clerk's offices are deputized, again, the offer of additional staffing through the transfer of employees from other areas was not welcomed at that time, but the clerk is willing to think through that some more. The other challenge that you mentioned with respect to employees because of the nature of the work, there are very limited telework options in the clerk's office. And so she has to grapple with things such as employee childcare being an issue, and all of the other things and challenges that are associated with the type of work that requires individuals to be on site. In terms of her operations, she is running on all cylinders, and all the functions required by the clerk's offices are up and running. One of the things that the clerk has found very beneficial is the mandatory e-file for cases. So that has proven very beneficial. It was in place before, but the fact that folks don't have to come in person to file court documents, that's been helpful. She viewed the public access computer lab as the highest risk operation because it is an area where her office allows the public to come in and do research. And so I'll talk about in section 4, some things that she has put into place to assist with that. As you know, and as Alton Adams has reported in previous meetings, the court system has moved to 100% virtual hearings. And so that has been extremely helpful. What we are going to try to do is assist with finding the clerk additional space so that she can socially distance employees who are required to be on site. And like for the tax commissioner, we are exploring technology to support the remote work environment. I think the clerk's office is farther along in that regard because they've already identified a solution. And so we are working with Glenn Melendez to test that solution and move forward with it. Lots of creative thinking in the clerk's office about how to adjust to our COVID environment. They are launching within the next couple of weeks a web-based appointment system, which will assist with not having a huge amount of constituents come down without an appointment to the court system to access services in the clerk's office. And again, for the public computer lab, what they have done is installed a remote assistance software on the public computers so that rather than having employees on site in person to assist constituents who come to use their computers, they can use the software on the computers, and the employees who are required to assist can do so in a remote environment. They're also exploring e-signing alternatives for judges, as well as a change in the law to require real estate filings to be e-file. Right now, real estate filings are not part of the mandatory e-file system. And so the clerk is working with her colleagues across the state in order to accomplish that. Next slide. So each meeting, commissioners, I like to leave you with what our sort of next steps are in the process. As you see, we are continuing to increase in the number of cases, and more important than increasing, even with the decline, we are a long way from comfortable numbers as it relates to positive cases. And so for that reason, we expect that we will be coming back to the board probably in the August recess meeting with a recommendation around reinstituting hazard pay for employees. As schools open, we know that we will have childcare issues associated with employees who are required to be on site. And so we also anticipate coming forward with a recommendation around extending our previous employee child care support. We'd also like and Matt can explain this one a little bit more. We'd also like the Board of Commissioners to consider WWW guidelines, which are general guidelines to wear a mask, wash your hands for 20 seconds, and watch your distance, which are sort of generally acceptable guidelines that will reduce the risk of infection without offending what the governor has stated in his emergency order. So something that is complementary to the governor's order is something that we would bring forward for your consideration as well. And we've talked about this a number of times. Our number 2 is to come back to the board in the August recess meeting with a view of our reimagined service delivery for those services that are at high risk for contracting the disease. So mostly within our Health and Human Services area, but also in our court services area as well. Next slide. At this time, Mr. Chairman, if the board has any questions about the presentation on the lines of business, we'll take them. Otherwise, we'll go into our CARES funding.
All right, thank you very much, Madam COO. Commissioner, any questions for the COO?
This is Commissioner Hall. I just want to say outstanding job. I love how we're taking care of child care for the employees and the PPEs and all of that. It is so necessary during this time because there's so many people who are impacted negatively by COVID-19. So great job on looking out for the care of our employees.
Commissioners, anyone else? Anyone else?
Yes. Thank you, Ms. Roach, Mr. Chairman. Thank you. Great job. You guys are handling things very well. And I know it's tough as the ground is moving underneath us, so to speak. In terms of a mask mandate or however, as close as we can get to a mask mandate, I know I did push some legislation encouraging the use of masks. Are you saying we need to maybe come up with something a little bit more robust, which I definitely want to do? I understand the governor's kind of tied our hands on the mandate, which makes sense to me. If you're out in the public, I don't see any reason why you shouldn't be required to wear a mask. So we want to do something like that, I'm pretty sure. And how close do we need it? If we can draft something up to get us as close as we can to make sure we've done everything we could within our power to make sure we encourage extreme encouragement that if you're out in the public to wear a mask, wash your hands and keep your distance from folks to lessen these deaths in our neighborhoods. So whatever we can come up with, Ms. Hooker, let's come up with something that along the lines of what Ms. Roach was speaking on but I want to take us all the way to the boundary of constraint with the state as far as we can go. I'd like to see something that we can do to let the citizens know we did everything in our power to help mitigate this stuff.
Other commissioners, anybody else? Anyone else?
Yes, I have a comment.
Mr. Houseman?
Yes, first of all, I want to thank you, Ms. Roach, for your outreach to the probate judge. You and I have had many conversations about this. I've spoken to the county manager. We get lots of inquiries about how long it takes to do various things. Been going on for a while, not just with COVID, but it's been accelerated with the reopening. So I really appreciate it. I just want to say though that, we have folks that tell us they stand in line 6, 7, 8 hours and don't even get up close to even begin the process with someone. And then there's no consideration that they've spent that time in line, they have to start over. So I hope that we work into a system where their time spent in line carries over if it needs to the next time that they visit, get some sort of number, some sort of sequencing. I also think there needs to be some consideration for our elderly citizens. Had lots of folks that, just physically cannot stand in those long lines that need the services of probate to get their wills done or estates settled or various things like that. So just please add that to your list of concerns as you go forward with trying to work through this backlog and this problem. But it's definitely needed and it's long overdue. And I'm really happy to see us working on this because it's a direct impact to a lot of folks in our community. So thank you.
Anyone else? Anyone else? All right, thank you very much, Madam COO. Who's next?
Ms. Whitmore.
Ms. Whitmore?
Yes, yes, ma'am. We can move on to the next slide. Actually, go on to the next slide. Good morning, commissioners. This is Sharon Whitmore, the Chief Financial Officer. We have a few slides to share with you this morning on our CARES Fund update. This first slide provides you with a view again of how we've allocated the $104 million that we have received under the CARES Fund. As of July 31st, we had allocated or expensed 91 million of the 104 million. And of that 91 million, we have actually expended 29.9. If you look at the bottom of the slide, you'll see an orange box now that says total paid. We added that after the last meeting where there were questions about how much we had actually dispersed. So through July 31st, we have dispersed 29.9 million. Our next slide, please. Our allocations between our broad categories remained unchanged from the last reporting period. If you look at the left-hand side of this slide under budget changes, you'll see that when we reported to you in early July, we reported 21.1 million had been allocated for community relief, 25.2 for the health response, 48.7 for operational stability, and contained within that operational stability is the PPE cash that has been developed. We also had the municipality reserve at 2.5 million, and then a second wave reserve of 6.5. We've made no changes in the allocation from the last reporting period. On the commitment side, we have increased our total funds committed from the 90.7 million reported at our July 8th meeting to 91 million. And that change is composed of an additional allocation of $200,000 for legal services and the allocation of funds to purchase the additional equipment for background checks to address some of the backlog issues going on with the concealed carry permits in probate court. So those are the changes from the last reporting period. Next slide, please. This slide it's very difficult to read on screen. There's really no way to blow it up much larger to be able to see it. This is the detail of all of the outstanding purchase orders that we have against the CARES Fund. To date, or through July 31st, we have issued $33.6 million in purchase orders, and we have paid out $11.4 million against those purchase orders. So that 11.4 million is part of the total 29.9 disbursements. But we did want to show you the list of vendors and the types of items that we have actually entered into purchase order agreements with vendors and encumbered funds. And the color coding that is on the far right-hand side of both of the graphs on the paid, to the right of the paid column, that simply is a cue that we are using to understand what the the nature of that spend is going to be. For example, the dark blue box is based on demand. And if you look at the top of the left-hand graph, the third line down says CRM Services, Inc. That is for cleaning services. We have $1.7 million purchase order outstanding. We've paid $939,000 against that. And those are for the cleaning services that we have used when we have had a positive case, or in preparation for reopening when we did the barrier spray. So those are on an on-demand basis. We also have indicated with the light yellow, those items that will be paid as they are delivered. The light green is for items that have a periodic billing for services rendered, whether it's either weekly or monthly. And the orange item is it's a construction in process. And then the pink is everything that's associated with our PPE cash. And those will be, those encumbrances and purchase orders will be relieved as the items are received into the warehouse. So this document is actually one that we look at, we try to look at on a daily basis on our morning calls, just to see where we stand with our acquisitions under the CARES Act. Next slide, please. This next slide is also a slide that we look at on a daily basis, and it shows you a view of those items that we have a placeholder or a commitment for. A placeholder, the very top line, if you look at it, it says job training and $4 million. So that is where we've earmarked $4 million out of the community relief package to go towards the job training program. We haven't actually encumbered those funds because we haven't entered into an agreement yet with a provider, but this is how we keep track of where we have identified a use for the funds. And on this slide, you'll see that we have some color coding as well. One being the plan is in process and the other being review needed. So where we have plan and process, that means we're still working on developing the plan, or we are in the beginning stages of executing against the plan. And then the red is one that we're looking at if we don't see progress on that particular placeholder, then we may need to make a decision to pull back those funds and put them in use somewhere else. And then on the right-hand side of the slide, you'll see the total amount that we have dispersed and who we have actually made payments to. The largest amount out of our disbursements have been the payments that we made under our community relief package, as well as the hazard pay that was offered to county employees in the late spring, early summer. So if you take everything together, the placeholder, the commitments, what we've paid and what we have encumbered, but remaining to be paid, that's how you get to the total $91 million that we've indicated that we have committed. And then at the bottom of the right-hand side of the slide, it'll show you where we have funds that we've allocated into one of the broad categories, but we as of yet have made a recommendation or a commitment for those funds. And that totals the total of $12.9 million. It includes almost $968,000 that remains in the health response, $5.5 million in the operational stability, and then the $6.4 million second wave reserve that we have set aside. Next slide, please. We wanted to share with you and also report out publicly the results of the requests that the municipalities have made for reimbursement under our municipal relief plan. We have received a total of $1.8 million in reimbursement requests. 2 cities currently do not have a request. The city of Mountain Park had indicated to us initially that they had no COVID-related costs. And then Palmetto, the city of Palmetto had indicated they have some, but we have not yet received their reimbursement requests. Those reimbursement requests were expected to be received by August the 1st. And the finance director has reached out to the city of Palmetto to see if they have anything to submit. Next slide, please. Commissioner Carn, this will perhaps address some of the comments that you had earlier about the process and the timing to get payments out to cities. So these are the next steps. We've received their reimbursement requests. We're in the finance department is in the process of reviewing the information that has been submitted to ensure that what's been submitted by the cities complies with the CARES Act, that all of the requested supporting documentation has been included. If they missed some supporting documentation, then we will reach out to them to obtain that documentation from them. Then we'll validate and compile, make sure that we know the total amount that we're going to be reimbursing. Our plan was to present that back to the Board of Commissioners so you would know the amount that we are intending to reimburse, and then finally to make payment by October 1st. That October 1st date is the date that was included in the draft agreement that was part of that was attached to the resolution that was passed by the board. So that is the date that we see as the latest date that we would make the payment. Not necessarily that we are holding off until October 1st to make that payment. We'll make the payments as soon as we've completed the review and have all of the supporting documentation in hand. So those are the next steps on the plan for the municipal reimbursement fund. Next slide, please. We shared this slide with you at the last meeting as well, just to give you a view of what the county has done that is assisting the municipalities both outside of Atlanta as well as the services that we're providing that benefit the entire county. And again, that was $22.2 million that we looked at as being the estimated municipal assistance outside the city, and 40.7 countywide, for a total of 62.9. Next slide. And the last thing that we wanted to share with you today is the report of the information that we received back from the OIG interim reporting. We were required to submit a report in the middle of July of our costs incurred through June 30th. And we received back communication from OIG of the entire program, but we wanted to share with you what was reported back to us from the state of Georgia. From OIG for all of the counties and cities and the state of Georgia itself, how everyone was spending. So the county, with our $104 million allocation through June 30th, we had reported a 20% spend rate. And you can see here how we compare with the city and all the other counties and the state, and how we've expended, or the rate at which I should say we've expended the resources that we were provided. And I think what's important to note on this screen is of that $20.8 million that was incurred, the vast majority of that spending went to the Community Relief Fund. as well as a good portion of that went into starting our testing program as well. So with that, if the board has any questions, we'll be happy to take.
Thank you very much, Ms. Whitmore. Commissioners? Any questions? Commissioner
Thank you,
Carn?
Ms. Whitmore. Great report. Glad to see we're on the ball with everything. In reference to our cities again, so I'm glad October is a drop dead deadline. Hopefully we can get some checks out sooner. I'm assuming some of those cities have checked all the boxes, and I guess the question would be how soon can they get a check out? The other cities that may need some help, this may be new for some cities applying for something along these lines, especially in this type of a pandemic situation. So how much help can we give them to expedite them along so they can get their checks as soon as possible? If you could give them a step-by-step, if there's a discrepancy here or there. I'm assuming you guys are reaching out to them, but again, what can we do to speed things along so they can get this funding in as soon as possible? That'd be a great big help to them. A lot of them may not know what to do, or they may have missed a step, or so on and so forth. So are we providing that detailed level of assistance and hand holding to make sure we walk them through this so they can get those allocations in?
We are prepared to do that where it's necessary, Commissioner Carn.
Well, let's just double check with them, because they may not know it's necessary, and we may know that we're waiting on this, that, and the other, and giving them a call or a reminder, or here's the process, or here's what you need to do. If you send this form in, we can cut you a check, kind of a thing. They've got dozens of things on their plates, just like we do, but that would be a big help. And I've talked several times over since I've been in office about a municipal liaison of some sort to help communicate with these 15 cities on a constant weekly basis. I think that's something that we really need to seriously consider as we come into the budget season. So thank you.
Anyone else? Anyone else?
Mr. Chair.
Commissioner Ellis?
Yeah, just one quick thing. Since we've got some of that fund that's still not obligated, were we closing out the opportunity for submissions into it, or are we going to extend that further till at least that 2.5 is exhausted?
I think that is the plan. Initially, we followed what was embodied in the agreement that was attached to the resolution that the board approved. So really, if it's the board's pleasure, I can tell you that there was an exhibit that was attached to the resolution that indicated the dollar amount for each of the cities. In some cases, what's been submitted to us exceeds the amount that was on that exhibit. And in some cases, what's been submitted to us is less than the amount that was on that exhibit. So I think that we may need the board to provide some direction, if you will, letting us know to expend the full 2.5 million, to expend up to whatever amount the cities have submitted actual reimbursement documentation for. The original resolution had a time frame of May 15th was the cutoff for those expenditures. The balance that's left, we could ask them to submit their costs through the end of July and see how much of that 2.5 we could utilize.
So let me try to help out here if I can. I think the commissioner's question, if I'm not incorrect, is the difference between the 1.8 and the 2.5. I believe the manager, if we get requests in for additional expenditures, then you would consider that, I would assume, correct?
We
Is that correct? Yeah, up to the 2.5.
Right, it doesn't require any further board action.
Yeah.
You all just created the fund and then gave the county manager the ability to use his discretion to expend the monies. And it was just, the attachment was just an example. It wasn't a commitment to give each of those cities that money. So we're okay with that.
And I think the reason that the numbers are where they are is because the federal requirements are pretty strict, and we were very careful, and we've been very conservative not to go beyond. We are not doing anything that's questionable now. So I think that when the cities look at what the federal requirements are in those three broad categories, then they sort of pare down what they originally thought were eligible expenses. So that's why this number, it comes in at 1.8. You recall the first report that we received based upon requests was right about 2.6. If you go further beyond that, that letter that went out, I think they were asking if you had followed that formula, it would have been around 25 million when in fact it's about 1.8. So I think we've done a really good job, because what I don't want to have happen, and I'm sure you all agree, I don't want us to be on the front page of the paper being fined for being in violation of the rules and regulations.
Yeah, Mr. Chair, yeah.
Mr. Ellis, you still have the floor, sorry.
Yeah, and I don't necessarily disagree with that sentiment. It just, if we needed to extend eligibility through the month of June so they could continue to submit expenses up until, qualified expenses, or through the end of July up until the point where we've exhausted the 2.5, and following kind of the same process, I'd see no reason why we shouldn't do that. So that's all I'm saying.
Right, no reason for that. Yeah, Mr. Manager, you have the authority to do that already, so I get the sentiment.
Well,
Or I think then the board have to approve the extension.
The extension of the dates is what, so that should be a motion, Commissioner Ellis. The program he can administer, but not the extension of the date for the expenses that they incurred. So if you want to go through June 30th until the money is exhausted, then that's fine. Whatever your board's pleasure is.
I'm fine putting that in the form of a motion to, extend the date to allow further submissions. So.
All right, is that a motion?
I would second that with a little discussion.
All right, properly moved and seconded. What's the discussion?
I agree. Obviously, the entire 2.5 million needs to go to these cities, but coming into July, we've seen the differences. August and September, these cities are going to have expenses that they don't know are even coming or even foreshadowed yet in terms of this pandemic. The debate's still there whether we're in the first wave or the second wave. 2.5 million is a good start. But I'm going to say once again, I think these cities deserve a lot more of this funding for them to put to use on a block by block basis. I don't believe 2.5 is enough. And I think at some point we need another round. I support your motion, but I want to put on the record that I think our cities probably deserve a little bit more of this money directly in hand. Maybe we set up another round of this possibly in the future, but I just want to put that out there once again.
All right.
This is Commissioner Hall.
Go ahead, Commissioner Hall.
I want to add to what Commissioner Carn's saying, because in the letter from the governor, it specifically indicated that Fulton County was able to be awarded the amount of money that we received because of the fact that we utilized the populations of those cities to increase our number of population to even be able to qualify for the amount of funding that we received. So I do believe that they should have more, as much as they need. And I do agree on this $2.5 million. It needs to go out.
Okay. Ms. Whitmore, do I see your hand?
I was simply going to say that I felt like, based on the board's original resolution, that we would need the motion that Commissioner Ellis has made to be able to extend the date. So that was it.
Okay, Commissioner House.
I have a comment. Yeah. I agree wholeheartedly that we need to at the minimum extend the date for the 2.5, and I agree too that that's insufficient. In the amount that we have allocated to the cities. I'm very sensitive to following the federal guidelines and all the reporting requirements. But we were just given that lump sum amount of money with no requirements. We have to do them on the back end. And so I don't know why in the world we can't have a trust arrangement or some sort of document with our cities that all their expenses that they're reimbursed for will comply, or they'll have to come back. Seems to me like an easy thing for us to accomplish, and not make them wait till October or some date in the future, because they've already expended this money. They're waiting and waiting. We had the good fortune of getting it up front, and they did not. I do think for the benefit of the public, though, it's something that they should understand, that $84 million out of the Fulton County allotment went to the city of Atlanta because of their 500,000 population number. And so that came right off the top. If you look at what Cobb and Gwinnett got, Gwinnett, I believe, got $163 million and Cobb got 132, because none of their cities got money directly. And so we're in a different situation because of that $84 million that Atlanta got. But that doesn't mean that our cities don't have true expenses and true needs that need to be met. I see that Atlanta hasn't reported a lot of expenses already. Are we working with Atlanta at all to try and, maybe equalize some of this? Because our expenses are countywide. Yes, it's based on population numbers, but we're serving citizens of Atlanta as well with testing and various other things. So are there discussions going on with City of Atlanta? They got almost as much money as we did just for their city to try and help equalize this throughout the county. Is there any effort there?
Well, the primary effort is the one that Dr. Paxton reported on, which is 7.7 million to support the testing effort. There's no other discussions or no other, carefully how I phrase this, that had been opened up, not based on us not having an effort, but in terms of openness to look at what you're suggesting. So the one item is testing.
Well, and I appreciate your cautiousness, but I do think it's the elephant in the room here. I don't know if Atlanta will have $84 million worth of direct expenses with regard to COVID, but our other cities are hurting. And so I would like for us to at least attempt to have some sort of conversation about the situation we find ourselves in. I think our expenses have been legitimate. They have served the entire county. I think we've shown that over and over and over again. But that does not negate the fact that the cities do have expenses that are not being met, that are directly related to COVID. And 2.5 million is not going to cover them. I think we all recognize that. So I hope that there's a way that we can figure this out. And, our largest city, obviously, I think has a role to play with this. And so I'm requesting that we do reach out to Atlanta to try and figure out how to work together as one county to serve the citizens throughout the county.
We can do that, Commissioner, and we will do that.
Thank you.
Mr. Chair.
Vice Chair Arrington.
So I want to be very clear about how all of this transpired. I'm a little confused. I'm certainly happy to support our cities, but I want us to be crystal clear about how we got to where we are today. We got money from the federal government through the CARES Act, $104 million. And we began to act on spending that money and to providing relief and resources to the citizens of Fulton County. We did that, and we also allocated a certain amount towards the cities and asked them to submit for reimbursement. So I'm confused as to how the cities can say they need all this money when they had the opportunity to submit expenses and chose not to. I'm confused. And I guess as to Commissioner Ellis's motion, if we extend the date, but we've already expended 1.8 of the 2.5. So that means there's only 700,000 left, right?
That's correct.
And so, you know, at the time when we got the governor's letter, 80% of the money had already been spent. In fact, we would have been negligent if we had not taken action to spend this money, to secure PPE, and to do the things that our staff and manager have been working on. So I don't understand the argument of these cities. We got money, we acted on it. We asked them if they had expenses to submit them. They did that. And, you know, I don't understand, because they're acting like we had the 104, that we hadn't spent 80% of it by the time we got this letter from the governor. So I'm a little confused. If we need to allocate, if the board is willing to allocate maybe another 2.5 million or whatever, but extending the deadline is almost like we really need a new, I don't know. I mean, the 700,000 is still there. I guess we need a new motion to allow them to resubmit, but they're resubmitting for 700,000 unless we're saying we're going to allocate an additional 2.5 million. And I just don't know what those expenses are from a citywide basis, but I know that when we asked them to submit, they only, you know, they didn't submit that much in expenses to show that they had been spending that much on COVID anyway. So again, I'm down to,
It only went through a certain time period, though.
All right. The motion before us to extend the date.
I said it only went through a certain time period, so they've had ongoing expenses since then.
And I think from a city perspective, these cities were blindsided by this. What some of the other counties did, though, when they received the funds, is they initially sat down with their prospective cities within their counties to discuss it. And to be quite frankly, a lot of us didn't know how this money could be allocated or spent, including us starting out, because we didn't know what all we were going to spend it on in the beginning. Going into this thing now, though, and let's also look at another thing. You know, a lot of most of our mayors in our cities haven't been in five years or less. So we got a lot of new folks on board. A lot of them I served with as council members when they were council members, for instance, or commissioners or whatever have you. And so a lot of this is new for everybody in terms of what needs to be expedited. But going into this month, I can tell you, there are going to be items that they're looking at that they did not expect to have, that they didn't think about in April or May or in June. That
well,
now
the other side of this story, that has to be told, though, is that the state of Georgia received money and they distributed money to all cities except for 59 cities. If the state of Georgia had given those cities money, there would only have been a 5% difference. But as a result of not giving these urban cities any money, those rural cities got 50% more money. And so, you know, we're being made to be the bad guy when the governor is the one that could have given all of those cities money. And every city could have gotten money. And so it's the governor that did not give those 59 cities any money. Don't blame it on Fulton County. I mean, if we're gonna sit down and talk, I'm happy to sit down and talk, but we've got to have an intelligent discussion. And that discussion includes the fact that the governor chose, for whatever reason, not to give those 59 cities any money. And it just happens that those 59 cities are in metropolitan Atlanta. I mean, so, you know, there's plenty of blame to go around, but this is not really about blaming people. This is about trying to help people and come up with money when and where is needed. So if they have additional requests, I mean, to me, it's not even extending it, because that May deadline is already gone and passed. We've got 700,000 left over. if we're gonna do another program, we ought to just do another program and give a new deadline. Like that program and that deadline is over, it's done. Right? I mean, why would we now extend a program that ended in May in August? Like if we're gonna do something else for the cities, let's just do something else for the cities. But to wait till August 5th to extend the May program that has $700,000 left, that doesn't make much sense to me.
Vice Chair, I think you're absolutely correct, but let's vote this motion up or down. So the motion before us is to approve the Ellis motion. All right, Commissioner Houseman?
To extend the deadline for the cities to submit requests for reimbursements through July 31st.
Commissioner Houseman?
Yes.
Commissioner Ellis?
Yes.
Commissioner Morris?
Yes.
Commissioner Hall?
Yes.
Vice Chair Arrington?
Yes.
Commissioner Carn?
Yes.
And I vote yes.
And
Thank you.
motion passes unanimously.
All right, anything else, Commissioner? It's not Commissioner. What is it?
Yeah, I wasn't finished.
I'm sorry, not CO. Commissioner Houseman.
Yeah, I just want to say for the record that while, you know, it's been reported that we haven't helped our cities, we know differently with everything we've done, plus the 2.5. And for example, Gwinnett County that got 163 million has only set aside 5 million for their cities. While they do have a lot of unincorporated area, they also have maybe 8 or 10 cities in Gwinnett County. So we're not that far out of line, but I do think we can do better. But I had a question about some of the expenses that were listed. Ms. Whitmore? You mentioned legal services. What's that about?
That's for services provided by a firm that's been advising us on utilization of the CARES Act funds, as well as reviewing our compliance to ensure that we are meeting all of the required reporting deadlines and those sort of items. I'm not sure if Patrice wants to add anything else to that or not.
You've gotten it. They've just been on call for the advisory services associated with this program because of the risk associated with this new program.
Okay, I assume I see the firm name listed. I won't say it publicly. We engaged them, I believe, to deal with stuff with the airport. Is that not correct?
That's the same firm. Yeah, and they are doing some COVID-related grant funding. Funding.
I don't recall authorizing that as a board. Was that not necessary?
You don't generally authorize all attorneys, utilization of attorneys. I generally can authorize them if we have a funding source, and this was the funding source for that particular engagement. But I do engage attorneys from time to time to advise us on a whole host of issues that matters.
Well, while we're talking about money, $200,000 is a big number to not have any board input. So I'm just stating that for my opinion for the record. I also recall, I'm very happy we've got the 3M arrangement for masks, but I recall an initial purchase that was made for masks and we were having difficulty getting that product. What happened with that item, please?
My understanding, Commissioner Hausman, that we are working with that particular vendor on receiving a refund of the funds that have been paid for them, where they have not been able to deliver the items ordered.
Okay, so we have not received any refund at this point?
No, ma'am.
Okay, if I recall, that was also a very large expense. So I hope that we're making every effort to recover those funds.
We are.
And would you please keep us updated on that?
Yes, ma'am.
This is Commissioner Hall.
Go ahead, Commissioner Hall.
I was reading some of the COVID-19 rules and regulations recently, and I have a question about the use of our COVID-19 funds. Have we paid any of our employees with the COVID-19 funds?
The COVID-19 funds for the hazard pay. And we have used the COVID-19 funds for professional services where, for example, the support staff that are helping the EMA office. We've used the CARES Act funds to cover those costs.
So, but have we used the COVID-19 funds for those employees who are specifically doing COVID-19 tasks?
We have not tried to offset any of our normal payroll related costs, Commissioner Hall. We've only at this point used the CARES Act funds for hazard duty pay. So, you know, for example, the staff that have been assigned or reassigned out to our specimen collection centers, we have not identified those costs as CARES Act costs because we did have that particular individual's you know, salary contemplated in our budget, albeit maybe, you know, in their regular job, not, you know, out at a specimen collection center. But, so we have not charged the CARES Act for any of those costs.
Thank you.
Other questions? No further questions. All right, Madam CO, who's next?
Fulton Adams.
Fulton, yeah.
Mr. Adams, you with us?
I am. Good afternoon, Chairman Pitts and Vice Chairman Arrington and Commissioners. I'm going to give you a brief update, and I believe that Colonel Adger is on the phone as well. I'm going to cover two topics. One will be a brief update on the jail, and then a update on the court system as well. On the first slide, in terms of the jail population, what we have seen over the last few weeks is a slight uptick. Actually, the updated number for today is 2,505 individuals at the jail. That's up from 2,436 on July 5th, and that is a measurable number, and it really represents a trend that shows us bringing more individuals in on a daily basis than we're able to, in fact, have leave the jail. And it's something that we are keeping an eye on because one of the key issues in terms of dealing with COVID is trying to minimize the number of people in the jail. And I believe Colonel Adger is on as well, so I'll run through these 3 bullet points. I'll stop and then see if the Colonel would like to add something. Secondly, in terms of COVID cases, here again we've seen a significant increase for a number of weeks, actually 8 weeks. We had no cases that were being treated. Today, we have 36 individuals who are in quarantine for COVID. And here again, an update from yesterday. We have 2 individuals who are awaiting results. The concern for us is not only that we have had a significant change in the numbers, but that while we expect that there will continue to be individuals who become part of quarantine and then move out of quarantine, this does establish a significantly higher high watermark for us. And so we have begun planning accordingly in terms of resources and so on, which I will talk to on the next slide. And then finally, in light of...
1 second.
Yes, sir.
I want to clarify,
the point you're making. Not only are people being quarantined, and the people that are being quarantined are those who are suspected, but then there are the people who are then isolated, who are verified positive. So those are two different groups of people. Both groups of people require additional space here in the jail. Right now we have space for both the isolation of individuals and the quarantining of individuals. But if the jail population continues to increase, or if the COVID-19 positive cases continue to increase, then that's going to become problematic.
Okay, great. Thank you, Colonel. And then finally, we had planned on resuming some limited transport of individuals, of detainees from the jail to the courthouse on July 27th. We saw an uptick, as I mentioned, in terms of the number of cases, and based on that, in discussions with Judge Brasher and Judge McBurney and Colonel Jones and Colonel Moffitt, the decision was made to not, in fact, resume transport until further notice. And so, at this point in time, we are not transporting individuals from the jail to the courthouse out of an abundance of caution. And the Department of Corrections, similar to where they were when we had the initial breakout of COVID back in March, has halted transport to correctional facilities. Now, I know, Colonel, I don't know if you want to comment on that, but as you can imagine, the inability to move individuals to correction facilities is also one of those things that has an impact on the overall jail population that Colonel Adger just mentioned.
It is, and we've been fortunate on several occasions because of our ability to test people here in the jail to move a limited number of people to Department of Corrections. But once again, we're in another halt. And that not only includes newly sentenced individuals who've been recently convicted and sentenced, but it also includes those individuals who were court production ordered inmates brought back from prison and are awaiting to return to prison. So once again, depending on how long that continues, it can become problematic.
Great. Next slide, please. So in terms of specific actions to address not only the current, but potential continued rise in COVID cases, there are three big categories of actions that we're taking. First and foremost is the continuation of the entry and movement restrictions within the jail. And so the access to the jail is limited to attorneys and to a small group of others. But for the most part, we will continue for the foreseeable future to restrict access to the jail. We also are doing everything we can to minimize movement of detainees within the jail complex itself. And so that includes being able to deploy, which we've already done, but we're going to increase it, but to deploy laptops to each floor of the jail to allow hearings to continue without having to move individuals through the entire jail. And then finally, one of the key actions we're taking is requiring PPE for all detainees as well as staff. And we started that some weeks ago. That will continue, and we will continue to replace the PPE for detainees. And that's part of our request when it comes to additional funding from the COVID or from the CARE funds. The second area of focus is going to be expanded use of testing. As Colonel Adger alluded to, we actually have a rapid testing machine at the jail that allows us to have a lot of flexibility when it comes to testing new arrivals into the jail, as well as testing individuals who, in fact, may have been exposed to COVID. It also allows us to lessen the time required for quarantining individuals. So a very important part of our testing process, and we will continue to use that as we continue to focus on managing the COVID. The second area is continued testing for deputies and staff. We have hundreds of deputies that come into the jail on any given day, and as you would expect, as part of the community itself, and with the community seeing greater cases, we expect that you would see some of that in the jail. To be able to manage that, we're working with the Board of Health. They're actually going to have a mobile unit. I think it's going to be on site either next week or the following week, and we're going to do that and have a cadence to that to allow us to provide the opportunity to staff and deputies to get tested on a regular basis. And then finally, there's some very specific high-risk, vulnerable populations that have been identified. These are individuals who are over 60, individuals who have pre-existing conditions like diabetes and high blood pressure. And so for those individuals, the ability to use the rapid testing unit to test those when they need it, or when we think that, in fact, they may have been exposed, is going to be a core part of our testing process moving forward. And then finally, in terms of the approach, we talk about this as being treating in place. And what that means is that for a number of the individuals that are in the jail, and if we see increased cases, we're making the assumption that we will not be able to transport large numbers, for example, to Grady and other places. Obviously, we avail ourselves of that when we can. I think we have 2 people at Grady who are being treated at Grady. But our plan at this point in time is to establish the resources and the plans to allow us to treat individuals at the jail and in a number of cases within the pods that they currently reside. We work closely with NAFCARE and Colonel Adger and his team. We had a meeting last week, went through the details in terms of when we actually are going to need to add additional nursing resources, as well as additional deputy resources associated with increases in COVID at the jail. Secondly, we are in fact looking at other technologies that can be used to minimize the spread when it comes to sanitization. So for example, we're looking at the use of UV lighting and the use of HEPA filters, and in terms of putting them at specific locations within the jail that can in fact be helpful in terms of managing the spread of the virus. And finally, we continue to work very, very closely with the Board of Health. I want to thank Dr. Holland. He makes himself readily available, responds very quickly, and really does work hand in hand with Colonel Adger and his team and the team from NAFCARE in terms of making sure that we have the most current thinking and that we have the ability to tap into the Department of Health resources when needed.
And if I could jump in,
there. Yeah, please, Colonel.
If I could jump in real quick, I'd like to extend that appreciation as well. We have the services of at least one Board of Health nurse who does a lot of the testing here at the jail. And the testing, they've been really accommodating in that they'll test anybody that requests a test beyond just the targeted individuals or those that are symptomatic. So we're encouraging inmates through various methods to volunteer to be tested, both on intake and once they get up in the general population. And the Board of Health nurse has been really helpful with that. So we appreciate that as well.
Hey, Alton, could you and Colonel Adger, for the benefit of the public, also comment on the medical certification that was just achieved by the Sheriff's Department and NAFCARE?
Colonel, please.
Sure. And as the county manager just indicated, we received a notification yesterday that we will be getting our national accreditation for correctional health care here at the Fulton County Jail. And consider that we were able to do this during a time where everything was in flux due to the pandemic and other issues. The medical staff and the security staff here at the jail were committed to obtaining that accreditation and being able to show the citizens of Fulton County that we take healthcare here at the Fulton County Jail extremely serious.
Thank you, Colonel. And that is a big deal. The process for preparing for that evaluation and audit is very extensive. They actually spent a number of days visiting with us back in February, pre-COVID, looking at a number of the actions that Colonel Adja's team and NAFCA have taken together. And they made a couple of recommendations on things that needed to be fixed, and they needed a plan. They developed a plan. They came back in and looked at what we had been doing. And to the colonel's point, we received yesterday, actually, the official notification that we had regained accreditation. So certainly gonna extend my appreciation to the colonel and his team, and to NAFCA as well, as being a good partner with us in this whole effort. Are there any other questions in the jail before I move on to the court side?
Alton, we're going to go straight and finalize the presentation and take questions at the end.
Okay, thank you, Anna. So very quickly, on the court side, Anna referenced the continued operations of probate court and the clerk, so I won't add anything to that. Obviously, the probate court continues to provide most of their services, wills, gun licenses, and so on. You can find that information on their website. In terms of the court calendars themselves, we continue to run first appearances, a full calendar of first appearances virtually. And as Anna mentioned, we as a system moved to virtual hearings very, very quickly after the beginning and onset of the virus. Juvenile court continues to operate somewhat limited, but they are operating. State court as well. Superior Court limited, and will resume cases associated with temporary restraining orders in August. And magistrate courts, their civil calendar will resume in August. I believe the target is for August 10th to begin some of those civil cases. There is a renewed emphasis on teleworking and virtual operations at the courthouse in response to some of the increases that we've seen in departments, increases in COVID cases. So very, very much a focus on teleworking and virtual operations where possible. To help facilitate that, we have asked for and made a recommendation, received approval to move forward and in increasing our capacity at the jail and at the courthouse to do virtual hearings. And so just as I give you a sense of the order of magnitude, today we have a laptop on each floor of the jail to help facilitate that. Our request was to increase that to 3 laptops, basically 3 Zoom rooms. What that will allow us to do is to have one of those rooms for state court, for magistrate court, for superior court. It will also allow us to have capacity to help facilitate more discussions between attorneys and their clients, as well as for us to begin some limited competency hearings using that technology. So very important in terms of helping us continue to keep things running while at the same time, obviously making sure that everyone is safe. And then finally, Odyssey 2019. Odyssey is the technology platform that supports the justice system. Everything from jail manager to the services at the DA and the solicitor and the clerk. They all run on this platform that's provided to us by Tyler. We have not had an upgrade to that in 10 years. We actually have been working on an upgrade. It is scheduled to launch on Monday the 10th. And the reason I include it here is because it has significant implications for improving the cross-agency visibility, to reducing paper in terms of what needs to happen to actually facilitate the trials and the processes. And it really is a big deal in terms of being able to impact and improve the efficiency and the effectiveness of the entire system. To give you a sense of order of magnitude, it required us to train 1,600 users. That's how many people we have on the system. And they in fact, spent more than 14,000 hours total kind of learning the new system. So we're pretty excited about it because it allows us to do a number of things that we've been trying to do for years that we're going to be able to do in an automated fashion moving forward. So I'm stopped there and happy to take any questions.
All right, are there questions? Questions? No? Okay, thank you very much. Madam CO, anything else?
Thank you, Mr. Chairman. That's the end of the COVID update for today.
Fantastic, we're doing better. Thank you. Thank you so much.
Yes,
All
sir.
right, let's, it's about 1:15. Let's take the BOH resolution up so that Dr. Paxton and Mr. Harden can get back to work. That we moved that up, didn't we?
Yes.
All right, you sound now.
Okay, on page 17, 20-0490, request approval of a resolution in support of a continuing transition of the Fulton County Board of Health to a fully self-sufficient state entity. Sponsored by Chairman Pitt.
Okay, just briefly, this all began as was stated at the last meeting back in 2016 when the House Bill 885 was approved by the state legislature, which started this process. And in 2017, the Board of Commissioners took action to further the process along and to further the process along. This legislation is a continuation of that effort, and it involves the finance department, the IT department, and the HR department. There are of the resolves that are involved here, which is where the action is. The second, third, fourth, and fifth resolves all involve finance. The sixth one involves, number 6 involves HR, and number 8, IT. And there's some, I've been looking at this, there's some 300 employees there, and about a third of them are basically environmental types, which do inspections, and well, about 40 of them are environmental types, and another 60 or so are have something to do with nursing, and the rest then are medical techs, admin types, and so forth. But this process has been ongoing, and we need to, to move forward with it. So I'm hoping that we can take some action today, favorable action on this resolution. Dr. Paxton is available, as well as Mr. Jack Harden, who chairs the Board of Health. So Mr. Harden, you want to add anything? Are you there?
Yes, I just had to unmute. First of all, thank you, Mr. Chairman, for introducing this resolution, and thank you for the opportunity to be in front of the Board of Commissioners. I can speak for the Board of Health that this is an important step as we view it in our process of becoming self-sufficient and becoming more effective in delivering the public health responsibilities we're charged with. And just to remind the Board of Commissioners, our district health director has a dual reporting relationship to us and also up to the Commissioner of Public Health for the state of Georgia. And we are in the process of conforming our operations in Fulton County to those of all the other counties in the state. And as I've shared with some of the commissioners in conversations we've had over the last few weeks, in my, I'm sad to say, 5 decades of corporate law and M&A practice, I've had a number of experiences in which operations are transferred, particularly when you acquire a subsidiary of a larger company, and the entity that you're acquiring doesn't have all of the support services, finance, HR, and so forth. And so you go through a period of time in the first stages where you rely on the seeding organization for those services. But we are now ready in our judgment at the Board of Health to take the next step of being our own fiscal agent and managing our own human resources. And a part of that, of course, is also having our own IT. So I'm grateful that this issue is before the Board of Commissioners, and I would just say on behalf of the Board of Health, we hope that the outcome is favorable. And thank you.
Mr. Chairman?
Yes. Who is that?
That's Commissioner Morris.
Morris.
In the packet, there is a revised resolution and then a redlined resolution, and I didn't get a chance last night to really really take a real hard look at that. Is that revision since our last meeting when this was
Yes.
presented to us?
Yes,
And therefore the revision is before us, I gather.
that's correct.
Could the county attorney just briefly tell us what those revisions might have been since we saw this at our last meeting?
Now, this should have been in their package.
Yeah, it was on Friday. It's a part of the board package. The revised version was stamped, revised 7/31/2020. And basically the major changes, Commissioner, were to remove all of the obligations with regard to funding and transfer, funding for the salary differentials for people who may transfer to the state. He's not dealing with any of those employment issues in this matter. It still retains returning the returning dream positions that were taken when we were going to this consolidated kind of service agreement arrangement. We're turning them back to the Board of Health because they're already working exclusively for the Board of Health. That didn't change. That is still in there, but all of the other sections with regard to personnel matters and funds for personnel and pension benefits were removed.
So the employment subsidy fund provision was removed?
Yes, sir.
That never should have been in there. That was a working number. So we're not dealing with the wealth of the employees being transferred now. That was an attempt by someone to address the issue of the pay differential and the benefits differential. I have some very specific thoughts on that I'll, at some point, but that I will talk with the board about, but that's not a part of this. Those other, that would involve those probably 250 plus employees, but that's not included in this.
Okay, well, that's helpful for me to sort out the three versions in my packet here and which one's before us. So thank you. I understand that now.
This is Commissioner Hall.
Mr. Chairman, if I still have the floor, could I go ahead and move approval?
Followed by Commissioner Hall.
I'll go ahead and move approval, Mr. Chairman.
I'm sorry, I'll second it. Commissioner Hall?
Yes. Can we go to page 4 on the revised resolution, please?
Page 4, Commissioner Hall?
Page 4, line 8.
Page 4, line 8. That will be the fourth resolve, yes.
Okay, so it says, be it further resolved that beginning on September 1st, 2020, the chief financial officer shall provide and place into the checking account of the Fulton County Board of Health an equal monthly allocation of the budgeted funds allocated by Fulton County for public health activities through the Fulton County Board of Health each fiscal year, rather than providing support on a reimbursement basis. So can you please tell us what amount that would be going into their checking account from Fulton County? What would the amount be?
The CFO would have that. I don't know, Commissioner, but it's 1/12 of what was budgeted each year. But Sharon?
Sharon has her hand raised.
Commissioner Hall, currently the county's budgeted support for the Board of Health is $10.4 million. So it would be $866,666.
So 866,000, and I'm sorry, say the last 3 numbers again.
666.
666. Oh, 666. Good Lord. So that amount is going to automatically go from Fulton County to the Board of Health every year. That's what this is saying. Can I get some clarification?
Clarify.
My interpretation is that we would begin to make equal monthly installment payments of whatever amount of support the Board of Commissioners authorizes in its budget process. So if you authorize $12 million, then we would make equal monthly installment payments against that $12 million.
So, okay, I'm confused. So is this resolution making it where Fulton County Board of Commissioners will be in the same situation that they're currently in as it relates to the Board of Registrations and Elections, where we have no authority or say-so over what the Board of Health does, but we get blamed for everything because it has Fulton County's name on it? I'm trying to understand. And if we're giving it completely and totally to them, why are we still providing funding every year? I know that Fulton County is mandated by the state to provide health and human services, and that is what we must do. But if they're going to completely pull away from the county and the Board of Commissioners have no authority or say-so over the public health services and programs, then why are we continuing to pay for something that they want to completely have complete autonomy to?
Jack Harden.
Mr. Harden.
If I'm going to raise my hand, I need to also unmute. Thank you, Mr. Chairman and Commissioner Hall. In the budget that the Board of Health has approved for the coming year, and also the budget approved by the Fulton County Commission, the county will provide $10.4 million to the Board of Health. Currently, that money, together with fees that the Board of Health earns and state funding, comes to approximately $39 million. Each year, the Board of Health will have to make presentations to the Fulton County Commission in solicitation of its support, and will presumably continue to make regular reports both to county management and to the county as to what the Board of Health is doing. What this does is change the way in which the money that the Board of Commissioners has authorized is provided to us. It provides us an even monthly cash flow over which we get to spend in accordance with our budget, as opposed to requiring us to submit for reimbursement in retrospect. So it does not increase the financial burden of the county. It doesn't change the way in which we cooperate with the county and the delivery of services. It does give the Board of Health control over the amount of funds that have been approved for it to expend.
Okay, I'm sorry. So let me just I'm gonna repeat back to you what I heard you say. You said there's currently 10.4 million that the Board of Commissioners, or should I say Fulton County government, gives to the Board of Health, including with fees, it goes up to 39 million. Let me ask that question first.
The amount of money that the county gives plus the fees that the Board of Health earns aggregates 19.6 million. The state provides 19.6, and the funds the Board of Commissioners give us plus our fees adds to 16.9. So the 16.9 plus the 19.6 we get from state funding, plus 2.6 million we get in grants from other sources, brings us to our 39.2 million total budget.
Okay, so if we are completely giving up our Fulton County employees that work for the Board of Health and completely giving over all Board of Health functionality to the Board of Health and the state, then why are we continuing to pay anything into this every single year? Because the employees would then become state employees. Is that not correct?
They would be state employees.
They would, I'm sorry, they would be what?
They would be state employees.
Okay, so I've had a whole list of pastors and clergy contact me because of this resolution, and there are so many questions. I'm going to need the Chief Financial Officer and our Finance Director to please provide all these dollar amounts to provide clarity. How many employees is it? Because I've been told so many different things. First, I was told it was 170 Fulton County employees, and then I was told it was actually 346. And there's no clarification. I would think maybe the Chief Human Resources Officer is the person who could clarify that. And then how would we handle our employees? I thought that was going to be a presentation that would be provided today on this, because we've had a situation like this in the past where the employees it was said the employees were going to transfer, and we don't transfer. It actually happens that they get RIFT, which for the viewing and listening audience, that stands for a reduction in force, which is basically in layman's terms a layoff. And during this COVID-19, we don't want to lay off anybody. The last time we did this, thankfully, we didn't have a COVID-19 pandemic, but employees did go to the news and they did come to the BOC meeting and voiced negatively how Fulton County did not even try to take care of them. So I haven't heard anything about that either. There are a lot of unanswered questions here. Do we have anyone who, Jack, are you prepared, or anyone from the county executive staff prepared to answer those questions for our viewing and listening audience?
It's not the, excuse me, the employees that would be transferred to the Board of Health. The county attorney can speak to the actual process, but there'd be no period of time in which they were unemployed as a result of this process. They would simply be employed by the state and subject to the personnel policies and salary scales of the state, and take their direction as they currently do from our district health director. But there is no gap of unemployment in that process.
Actually, Commissioner Hall, this particular version, the revised 7/31/2020 version, does not deal with the issues that were previously presented in the resolution with regard to mandating any type of transfer, allocation, or reassignment of all of the personnel. The only persons who would be going over by virtue of this resolution was a request that the 10 employees who are currently Fulton County employees assigned to the Board of Health, but or from another budget, that those positions be transferred over, and the funding for those positions that they've been dealing with maintenance, and they actually are housed at the Board of Health facilities. They just wanted those people over there subject to their direction more completely. Everybody else, correct, some type of negotiation, some conversations with you guys, some in the next year as the board transitions on how to deal with the employees. They're just going to stay status quo right now.
So why could we not have just put all of that in this resolution to address? Can you hear me?
Yes, I can, ma'am.
I said, why can't we just put everything in this resolution to address everything at once, so that we don't have to piecemeal and come back? We can answer all these questions to the community leaders and everyone who is concerned, as well as the employees. And we don't have to continue to have Fulton County employees in a situation where their morale is really is shot, is gone. I mean, if we can go ahead and if we have answers, we need to just go ahead and provide that.
I just think the chair hasn't made that decision, because I don't think he's had a chance to talk to all of you all and figure out an answer. So what he's trying to do is to make certain that this part goes forward, and it's clear that they are moving toward the independence. And I wanted to get back to a couple of points that you made that you said were questions from the public.
Yes.
One, state mandated that this entity be created separately under a law they passed in 2016. Number two is that we are obligated under the state funding guidelines to provide a minimum threshold of funding to the Department of the Board of Health of Fulton County anyway, and it's based on the population. It is not $10 million, it may be around 6 or 7, but Fulton County has always wanted to have a more heightened presence with public health issues. And so they've always funded their health operations more than the minimum requirement. But the state mandated that we transition the services to a state entity. The state also mandates how much we have to pay at a minimum level. And just like Grady, they just wanted the money. Grady gets their money every year after you all approve it, and they just get their funding. They wanted for this transition year to get the funding 1/12 at a time rather than them being required to spend the money.
Right, but Grady doesn't have the Fulton County name on everything, their buildings and everything else. So, I mean, that's understandable. And I mean, I was here I was chief of staff to Commissioner Garner in 2016. And I recall that this IGA was put in place to protect the commissioners from being placed in a situation where we have an entity, another entity with the Fulton County name on it, that the constituents would believe that the Board of Commissioners have any type of say-so and authority over. And it was to allow, the IGA was to allow the commissioners to still continue to have some sort of say-so and authority over the services and programs and what was going to be provided to the community, because we deal so very closely with our constituents down into our neighborhoods, but the state does not do that. So this was to help us to continue to be able to do that. So I do recall, I think that you were here at that time, Madam County Attorney. Yeah, that's right. Okay.
I've got it.
Just a minute, I think Commissioner Arrington was next, then Commissioner Carn. Motion before us is to approve. Commissioner Vice Chair Arrington, followed by Commissioner Carn.
Thank you, Mr. Chair.
I'm sorry, I didn't even finish. I'm sorry. I thought I was pausing to allow anyone, Patrice or anyone else, to say something in relation to what I just said, but I have one other thing I wanted to just say. We are not mandated to transfer employees or give above 3.8 million. Go ahead, Commissioner Arrington. I'm sorry about that.
No problem, Commissioner Hall. So I wanted to understand from Madam County Attorney, are you saying that this would not be a RIF?
This particular resolution does not require a RIF at all. Now, it doesn't mean that down the road, as they become fully independent, that the board would not have to, whatever plan that is finally worked out with the county manager, HR, et cetera, to deal with this with the Board of Health, it will probably require a RIF in order to let them go and be rehired or considered for rehiring at the Board of Health. But that has not been addressed in this resolution.
Okay, wait a minute now. You say when they become fully independent. The Board of Health is already a fully independent entity, isn't it?
It really isn't, Commissioner, because of the ties, the strings that we have. And
wait. Either it is a separate entity or it is not. Does the Fulton County Board of Commissioners make decisions on behalf of the Fulton County Board of Health? Or does the Fulton County Board of Health make decisions on behalf of the Fulton County Board of Commissioners? There is no hybrid. Either they are a separate entity under state law or they are not, Madam County Attorney.
Chairman Arrington, they are a separate entity under state law, which has connecting strings right now to the county that hinders their ability to operate in the manner you just described.
So they are a separate entity.
Yes, they are.
And they have complete control over that entity. We do not make any decisions for them, do we? Does the Board of Commissioners make any decisions on behalf of the Fulton County Board of Health?
The Board of Commissioners does not.
Okay. So it's a separate entity. I just want to make sure we're clear.
Yes.
Mr. Commissioner, just a point of clarity. It is correct. The Board of Health is a separate entity, and the Board of Health has 7 members of its board, 4 of whom are appointed by Fulton County. And Fulton County also provides some of the financial support that goes into the budget. So while we're a separate entity and we make our own decisions, there's not insignificant amount of influence built into the structure for Fulton County, which appoints a majority of the board. Thank you.
Built into the current structure.
Well, what I just described would remain because that's set by law.
Well, no, it wouldn't. If we're giving up our budget, if we're giving up employees and all of our budget, then that amount of influence would be going away. All right, so I just want to make sure that we're all, I mean, I don't know how the vote is going to go, but we got to be intellectually honest. We can't sit here and act like they're not already a separate entity and that they don't already make their own decisions. That's just not intellectually honest. Okay, so we gotta start from the same position. They are already a separate entity. Now, how many employees are y'all talking about y'all want to fire?
Now, this legislation doesn't fire anybody, Vice Chair. This only deals with the way that the Board of Health will receive its annual allocation from the county.
Mr. Chair, you removed that language from the previous version so that you can try to get it passed through. This is the precursor. This is the precursor to a reduction in force. The county attorney just confirmed that.
There's no reduction. There is no reduction in force. At some point in the future, the employees will be or should be transferred over to the state based upon state law that was passed in 2016. That's all this is. This is another step in that transition. If it fails, then what I would suggest that we go back to the state legislature, get them to undo the law that was passed in 2016.
Madam County Attorney, wait a minute. I want to make sure that we're all saying the same thing now. The law that was created in 2016 allows for the transfer of employees?
It did not allow for the transfer of employees, Commissioner. What it allowed for was, it mandated the creation of a separate entity. Fulton County was the only remaining Board of Health that was just county run. And they said that those had to stop. We lost our protection of allowing ourselves to create our own Board of Health. And it allowed us to try to get into an arrangement with the Board of Health to try to transition it by July 1, 2017. We entered into an IGA to try to accomplish that. Because, as Commissioner Hall said, the concern of the board with regard to the transition of employees or change in status of employees, they ended up in a situation where all of these Fulton County employees stayed as is, but then they're having problems with managing they're having a problem exerting their independence, as you said, with regard to IT, finances, and I think it was in HR. So they're having their own issue trying to be independent. So that's how this got here. It does not, this particular resolution is not a precursor to anything other than a dialogue over the next year on how we should do this. And since the chairman didn't have any idea of what you all would like to do, he was trying to come up with an idea, or it was a proposal that he eliminated because it hadn't been vetted with everybody or talked to or necessary at this point in time to even deal with the transition of employees other than those 10 people.
Well, I mean, for every action, there's a reaction. I mean, we pass this, then at some point in the future, there's going to either have to be a transfer or a reduction in force. Is that correct?
That's correct.
Okay, and you said that the law doesn't allow for a transfer. Is that correct?
No, it's not that the law doesn't allow. The law did not mandate. You asked me whether or not that statute mandated the transfer of employees. It did not.
Does the law allow the transfer of county employees to state employees?
No, sir. It does not prohibit or does not address that.
It does not address that. Okay. All right. Now, when employees were going to the city of South Fulton, Were they transferred to the city of South Fulton?
No, sir, they were terminated with all of the efforts of the county manager and his team to help them try to get picked up by the city of South Fulton, but they were not transferred to an independent municipality.
So why do you think there will be a different process if the law doesn't provide for a different process?
I don't know what the process will be because it hasn't been discussed. And I think that part of this process is down the road, figuring out A, how many people do they need for their new operation? B, what do those people look like? And C, who currently has them now? As you know,
if we're not going to be honest, then we can't even have a conversation. I mean, these people are going to be fired. You can't do it any other way. If the law does not provide, if this law, the 2016 law, does not provide for a way of the transfer of county employees to state employees, then that means there has to be a rift that these people have to be fired, and then that they have to apply for new jobs with the state. Am I wrong?
No, you're not wrong, Vice Chairman.
So why won't you admit that? Why are you saying otherwise?
There is nothing on the floor before you to deal with how the employees are going to be treated, sir.
That's because it was purposefully left out. We still have to deal with the impact of these employees. Are you saying we aren't going to have to make a decision about whether to declare a RIF or not?
You have up to, based upon the legislation that was passed by this board, I believe it was 2017, you have up to 50 years to finalize this transaction. But this, though, today will give the Dr. Paxton and her few people the management tools that she needs. I've said this before. She cannot run, we cannot expect her to run that operation without being able to control her budget and the people who report to her. It's just, and IT. It's as simple as that. It will be
they
like
control their budget. They're a separate entity. We don't control their budget.
We don't know what. Okay.
They make all the decisions on how they're going to allocate the funds that they receive. That is what control your budget means. Now, what do you mean when you say control your budget?
That's what's not happening. They have to spend money, and then our county finance people think that they can say yes or no to purchases and acquisitions, and they make a decision. Finance in Fulton County, not the Board of Commissioners, but finance makes a decision of whether or not they're going to spend it, whether or not they can buy it, whether or not they can do things. So they have been controlling their operations, Commissioner.
That's undeniable. Well, let's do this. Let's do this.
Unlike undeniable is that they're already a separate entity.
This is Commissioner Holland going to go next.
Just a minute, everybody. I have the line up now. Arrington, then Karn, and back to Commissioner Hall. The motion on the floor is to approve. This does not deal with the bulk of the employees. This deals with three things only. And I would suggest that if it fails, I have no idea where we are, but we draft legislation to ask the state to repeal HB, what was it, 885 that was approved in 2016, if we want to keep it like it is, because I can tell you, it's going to be a revolving door. You lost Dr. Toomey because of this situation. You lost Dr. Ford because of this situation. And you're going to lose she's not going to say it, but you're going to lose Dr. Paxton. A manager cannot manage. If we were doing the same thing to Richard Anderson here, he would be gone tomorrow. He won't say that, but he'd be gone tomorrow. So we got her hands tied. We all say we love her, but we don't want to give her the tools that she needs to run that operation effectively.
Well, she hasn't been here long enough for any of us to make that type of determination, Mr. Chair.
Exactly.
You know, she's been on the job less than 60 days. So I don't know how you can make that determination or that assumption. But what I can say to you is that they are already a separate entity. That is undeniable. Now, if there are problems with the system, then we can correct the system or address the system. But to try to piecemeal this and do it in a fashion that does not address all the issues. If you want to do this, then we've got to be ready and able to address what are going to happen with these employees instead of talking around it like, oh, well, there won't be a rift. They'll just be transferred. When we know good and well that that is not what happened. That's just a lie. Why are we lying to people? Why are y'all lying to people to try to get this done? If you want to get it done, be honest, be truthful, and tell exactly what's going to happen. And let's come up with a plan to address how it's going to happen. But don't sit there and lie and just say it's going to be a transfer and the state law allows for the transfer. The state law does not allow for a transfer. That is a lie. If you want to do this, let's do it, but let's plan for it. Let's talk about all of the repercussions. Let's talk about all of the unintended consequences of the actions. They are already a separate entity. They make their own decisions. I have frustrations. This is the same frustration I had with the Fulton County Board of Registration and Elections. I don't want any more entities like this. And the ones that are there, I want to make sure we've got as much control as possible. Because you see what happens when we don't have control. When you look at our elections and how we're always the laughing stock of the state and the country for our election performance. And we have no control. All we do is give a budget. But don't sit there and lie and just say, oh, it's going to be a transfer. Oh, some point in the future, we'll have to address that. Let's address it now. That's part of what's going to happen. If you're talking about giving them all of these state employees, let's address it now. Let's be truthful about it. Let's not try to avoid the issue and say, oh, well, we'll deal with that tomorrow. We'll deal with that on another day. I'm going to carefully draft this resolution so that we can get it passed and avoid having to deal with all the real tough issues that are associated with it. That doesn't make any sense. That's not intellectually honest. Tell the truth. Don't lie. Don't say this is going to be a transfer of employees. That is a lie. And if you lie about that, what else are you lying about?
Commissioner Carn?
Thank you. Dr. Paxton, Jack, listen, we had a good meeting about this and we talked about a few things. Now, Jack and Dr. Paxton, I understand these are some of the tools you need. You need your tools to work with so you can do what you need to do. But we also needed the tools to make this decision and to make it understandable for us. If you all recall, I specifically asked and recommended that you do a one-pager executive summary explaining the ramifications of this so that we wouldn't be having this hour discussion right now. Now, I hadn't gotten anything like that, but Fulton County's Board of Health, it's independent, it's a mixed bag. Okay, and we need to be able to explain this to our constituents and our neighbors. As right now, we can't explain it to them in terms of, like Marvin said, the broad ramifications of this. Will our employees have to apply for new jobs with the state? That's a yes or no question. We need a yes answer or a no answer so we can make a good decision and our constituents can understand what we're voting on, what it's going to do potentially in the future. Now, if the state of Georgia passed this bill already, we don't have a choice in the matter. So what are we voting on if all of this going to happen anyway? Or are we voting to put the brakes on this thing or not? We talk about independence. Well, looking at the resolution, we will still be responsible for office space for housing these employees. Is that right? So you say we're independent. Our employees are going to be state employees. Well, yes and no. Our employees would be a quasi-state employees because if you're paying 100% of employees' pensions, I don't think that makes you 100% a state employee if the county's paying your pensions, for instance. So again, we need a one-pager explaining all of the ramifications in plain English, not in 6 different languages, where I can explain it to my high school aged constituent. We're gonna pay, how much will we pay in salary to the state's percentage? We need that clear so we can understand that we're accountable to our constituents. What are the state funding guidelines for the funding? I understand you all wanted autonomy. Also, I still haven't gotten a full realistic understanding of where your problem lies. Jack, who do you have to go to get an approval on something? Who is that person? Is that one person? And who is that person? I've listened to some of the board meetings. I've heard from some of the Board of Health board folks that you all have asked for things and have been turned down by Fulton County. I understand you asked for face masks for the public months ago, and you got a flat no. Well, I wasn't aware of that no. And I don't know who gave you that no. So I understand your dilemma where you want independence to operate your own budget the way you see fit as the health experts. That makes sense to me. That's understandable to me. So I support that part of it. However, if I'm going to vote on something, I need to be able to explain it to my constituents in a way that they can understand it. So when they ask the question, will these employees have to apply for new jobs with the state? Right now, the answer I would have to give them is, I don't know, because they didn't give us the information we needed. So it makes it harder for me to make a decision. I mean, I'm thinking anybody would understand that. Is that right? I asked for a one-page simple summary of what we're doing so that it can be explained to everybody and everybody can understand this. It is a mixed bag. So, if you're transferring something over to the state, this is not a full transfer to the state. If we're paying their full pension, if we're responsible for their office space, for housing them, for all of these things, yes or no, it's a transfer. It depends on who you ask and what perspective you're looking from. So we need an assessment and a summary that we can explain to residents so we know not only what we're voting on now, but what that leads to potentially. That's the most important part. No, it's not in this resolution, the ramifications of it, but we need the ramifications of it from our Board of Health experts. The ramifications are the most important. And again, I need to know who is that person responsible for you getting a green light. I heard someone say it was finance. Is that the case or because I don't know who it is?
You've asked several questions, if I might try to address them, and others may have things they wish to say. But in terms of the structure of the Board of Health, our Board of Health, together with all the other boards of health in the state, are separate legal entities, as Commissioner Arrington says. We are, however, connected both by state law and by the constituents we serve and by budgeting to the county in which we're located. The state law provides a minimum amount of funding that each county should contribute to its local Board of Health. In addition to that, it instructs the counties to assist in the provision of facilities and other things that the Board of Health needs. It does not specifically address the issue with respect to employees. And as to that and the one-page summary, let me say nothing about the employees other than these maintenance employees is before you today, because frankly, more work needs to be done. So as of what's in front of you today, it affects these maintenance employees who are already physically located in Board of Health facilities. Now, I say Board of Health facilities, they're actually county facilities which have been made available to the Board of Health. And I think in most, if not all cases, title remains with the county, as has the maintenance and support of facilities. But the important point on the budget issue that I'll come back to, and I think that was well stated by the chairman, we went out to hire the very best person we could get to become a public health director. And my view of good management is you hire a good person, you empower them, you support them, and you evaluate them. And it's difficult to ask somebody to come in and then have minute decisions subject to reconsideration by people outside the department. Dr. Paxton reports to us, and we will evaluate her performance, as will the Commissioner of Public Health of the state. But we hired her to run the health department. And frankly, I think the policy issue, who should be making public health decisions? Public health decisions should be made by a public health professional. In our case, we've hired Dr. Paxton to do that. If it turns out that she doesn't do a good job, then it'll be our responsibility to find somebody else. It's that simple. And you can't keep a good person if they're subject to micromanagement. So that's why the budget issue is important. We're not asking you to spend any more money than you make a decision to appropriate on an annual basis. We're just asking you to empower our public health board and its leader to manage that budget without having to get approval for every purchase order that they want to make. So I hope I've added some clarity to that.
Anything else, Commissioner Carn?
No, that's all I got.
Commissioner Hall, did you want to be heard again?
Yes, thank you. Okay, so first thing I want to address is I've heard several statements from Chairman and Madam County Attorney that this resolution doesn't address anything to do with employees, when in fact I'm sitting here reading the resolution, and on page 4, line 21, it is addressing employees. But unfortunately, it's only addressing the fact that the Chief Human Resources Officer shall move the 10 county positions that serve the Board of Health facilities full-time, along with the funds that support those positions, from the Department of Real Estate and Asset Management's budget to dedicated positions within the Board of Health. And it's a travesty that is only addressing just those few positions when we have hundreds of positions that fall under the Board of Health that are Fulton County positions. Now, let me go back and let's do some historical references. We had Dr. Toomey and we had Dr. Ford, who both were trying to do the same thing. And what was explained to me by both was that there were Fulton County employees that would have to be terminated if anything like this happened. And they wanted to terminate those employees. So what has changed now that employees will not be terminated? Because as Commissioner Arrington pointed out, there's nothing that says that they have to be transferred. And there's nothing that says that there's a law that requires them to be transferred. So we're back in the same situation that we've been in the past, where we have employees who are going to end up being laid off, and especially during this time where we have a COVID-19 pandemic. What kind of hearts do you have that you would do that to your own employees? So, Mr. County Manager, I want to ask you, was there a business case for the transfer of the employees that belong to Fulton County? Is there a business case that you can send us that perhaps has already been worked out?
No, ma'am, and I think that's kind of the crux of the issue. In the discussion that I had with Jack Harden a week or so ago, the first point, I think, when asked my view, was that and with all due respect, that the notion that the employees had to be transferred was not contemplated, nor was it proposed to the board in the original proposal. So that's why there is a 50-year IGA. That's point number one. Point number two would be, if now the Board of Health has come to a view that transferring the employees and the perhaps the freedom from Fulton County personnel policies would lead to higher levels of citizen service. And that is what you just asked for, a business case that would be developed, not unlike the one that we developed for the transition from behavioral health. But that business case has not been developed at this point. And in discussions, I think with Jack, he would agree that the first point is right, that the contemplation of transfer employees was not in the original proposal. And number two, that a business case potentially could be developed, but I think his view, not speaking for him, but where our conversation was, his view was that it's more at 100,000 foot level that the alignment of leadership, budget controls, and personnel actions make for a higher performing organization. And my view was, since it is such a significant transition, that a business case that would address not only the benefits that would accrue in terms of better levels of service and health outcomes ultimately, but also all of the issues that would have to be dealt with in such a transition would be mapped out and planned for, much like we did, on other transitions. And then I think the third piece that I just wanted to address to try to clear up is there is a huge level of interdependency that we have today, certainly in the middle of this pandemic, between Fulton County and the Board of Health. And I think that has actually worked to our benefit, not to our detriment. As we've made the case several times over, our performance, if you're trying to measure what's being done in response to this pandemic, has certainly been significantly more impactful than ones where they're operating in a more fully independent, if you want to call it that, structure. So the last piece is, I'm not aware of any decisions that we review. I haven't reviewed any, and then I'll come back to this issue of mask in just a moment, that we review on a routine basis for the Board of Health. They certainly, because they're using our procurement and the like, they have to adhere to guidelines that we use, as well as in the personnel world. They still, if they're going to make a termination or an employee decision, that has to go through our employment practices, which is recognized in Dr. Toomey's memo of March of 17 and the corresponding IGA. But I'm not aware of any decisions. If we want, somebody's used the term micromanaging, I'm not sure what that's referring to. Now, as it relates to masks, the only way that came up to be an issue is a very simple one, and that is Dr. Paxton presented a very high level plan for testing to this board. And in that plan was the request for 21 million in resources and the projection of testing over 400,000 folks. What we are looking for now is the details, and are working with them to develop those details for the plan for the rest of the year. Why those details are important is because these are based on CARES fund dollars. So we want the same level of specificity, same level of timing, same level of assurance that these dollars both will be spent on highest impact, as well as be spent by 12/31 that you saw in the CARES report today. We have not yet been able to complete that effort. Not saying anyone's resisting doing it. I think it's a process to get done. As we have begun to develop that effort, what we found was in the plan presented, there was not planning for all of the staffing for the mobile units, and then even the fixed unit up at 4700 North Point Parkway. So there were $3 million more that needed to be added to that plan. In addition to that, as was reported today, we are still awaiting Atlanta's 7.7 million that would be a resource for that plan. So there are several moving parts. The masks were a part of that plan. So that's one where I've said, until we see all of this plan come together and we know that we've got both the expense requirements and the resource requirements nailed down, and we know when they're going to be expended by, that I was not going to release $1 million for masks, which may or may not be the highest benefit in that entire plan. And quite frankly, have no sense of urgency associated with them, in that we have other sources of masks, both that Matt described today and other sources that that exist in the Board of Health. So that is a classic red herring in my mind. Not that they won't be done. It's a question of, let's put an entire plan together, of which that is less than 10% of even the requested amount to be expended. So that's neither here nor there in terms of this whole discussion. But that's the long answer, I suppose, Commissioner Hall, to your question about a business case. It has not been developed at this point.
Okay, Commissioner Hall, anything else?
Yes, first I want to say thank you so much, Dick, for everything that you just said. You just proved our point. I want to commend you and your team on always doing what was right by the employees at the Board of Health, who are Fulton County employees. Earlier, Madam County Attorney, you stated that we had on the Fulton County side, management that were trying to tell the Board of Health how to spend their money and do this and do that. And I just know that that is not it's not accurate. Dick and his team have never tried to overstep their boundaries on what they have the authority to do. They've only utilized what they were supposed to do, which is we have Fulton County employees, and those employees fall up under our employment system. And that is just part of the process. So, and the other thing I want to address, because this was said so many times, Fulton County employees at the Board of Health make more money than the state employees at the Board of Health, and that's a problem. I don't see how that's a problem to pay people what they're worth in a position. So I don't get how that has anything to do with them having autonomy and taking over everything. And my other question, Dick, was have you had any meetings with Dr. Paxton and the Board of Health to remediate the management employee issues at the Board of Health?
There have been a number of meetings between our staff, meaning Ken Herman, Hakeem, Oshikoa. I'm not sure about Felicia, but on a day-to-day basis. And there have been meetings in an attempt to make the process work better. We probably would have to get them involved to describe how those meetings have gone. I haven't personally sat down with either Dr. Ford or Dr. Paxton to try to make changes either to our HR, procurement, or financial systems.
All right, thank you. And so I just want to reiterate that this is piecemeal. We need a full and complete resolution that addresses everything. We don't want to put our employees in a situation, a negative situation, especially during this pandemic. And I don't see the urgency in trying to pass this today because we have so many unanswered questions. There are meetings that should have taken place. There's an, executive summary that should have been done, and just so much that needed to be addressed. And I, for one, answer to my constituents, and I've had too many of them contact me about this resolution, all the clergy in my district and seniors. And I mean, it's ridiculous. We need to do the work and do it completely and totally if we're going to do this and do it right. Thank you.
Mr. Chairman.
Yes, Commissioner Houseman.
Yes, I've listened to this with great interest. I too don't really recall a plan to transition all the employees this soon anyway, maybe 50 years, but not quite this soon. One of the things though that does seem to be a reasonable hindrance to the operations of the Board of Health is this issue of how they get their funding from Fulton County and having to get everything reimbursed. It seems entirely reasonable that their request to have monthly allocations for operating funds could be given to the department. And then they just have to submit whatever they spent it on that complies with the proper usage of the funds, but not do it in arrears, do it on the front end. So I don't know what the outcome of this particular vote would be, but if it does not go forward, I think it's entirely reasonable that we restructure the way that they are funded so that they can operate in a timely manner, especially in the era of a pandemic.
I agree with you, Commissioner Hausman. That was absolutely wonderful.
That's what the legislature does, and
There's a lot more than that, Mr. Chairman.
But there's an IT piece here. With respect to the where is it? One resolve regarding the 10 county positions.
Page 4,
Page
21.
4. Yeah, that's not a real deal breaker as far as I'm concerned. Those 10 employees, but the issue is the financial issue in those 2 IT issues that I think is the issue. So I'd say let's vote it up or vote it down, and then prepare legislation to ask the legislature to repeal it. That seems to be the sentiment. All right, the motion on the floor is to approve.
Mr. Chair,
Yes, sir. Commissioner
I
Ellis.
had my hand up and had a chance to say anything.
Afterwards. I'm sorry. See, so it's Commissioner Ellis followed by Commissioner Arrington.
Thank you.
So I guess a couple of things, and I'll get to my main point at the end of it, but the mechanics of all this, there's no need to ask the legislature to do anything. I mean, the arrangement that we're in was the arrangement that was assumed and by everybody that voted on it at that particular time. I think the issue today that we're faced with is what's not working, and should there be some things that should be changed. And it's in essence a revisiting of the IGA. We never entered in this with the view that we were going to be terminating the IGA in 2021 per se. It was assumed to be a hybrid model. Now, I think what we all want is a model that works most effectively for our citizens. So I think we're all aligned on that. I think that there are really probably 3 buckets of things. There are the financial aspects, there's the human resource aspects, and then maybe the sort of IT aspects of things. Obviously, the first 2 probably being the biggest ones. I think the financial aspects can be addressed via looking at the existing IGA and modifying the constructs within those. I think obviously that there are a number of larger issues that probably need to be explored with the HR aspects. In the IT, I'm not really kind of sure kind of what all is necessarily involved in that, but that could just be as simple as a modification of the IGA. I think that there's been enough discussion on this that at a minimum, if we're going to discuss something, we're going to like seek to vote to approve certain changes in the way that the operations are done. I do think we need a cleaned up resolution. Number one, if we're not going to do anything with employees, if this purports to do nothing with employees, then the piece about the facilities employees, I don't even know why that's in there. That should be out. Number two, if we are going to sort of leave open for discussion whether or not there's going to be a transfer of employees or not a transfer of employees, then the idea of this resolution calling for a new IGA to be the IGA basically to be terminated as of June 30, 2021, basically suggests that that's going to occur. So that those pieces should be struck. So, you know, if we want to take up something that just addresses the financial components, I think we need a clean resolution which does just that. And then if we want to come back and discuss the other things, whether those even things are even want to be brought back to the table, then we can do that. But my last point on all this is, listen, we are in the middle of the biggest health crisis we've ever faced. And these things may be important, and if there's something that's really hindering us from getting the job done to address this stuff, maybe let's take a quick hit and address it. But otherwise, we just all need to be united and on the same front and working for the benefit of our citizens. If I was tuning in and listening to this, I would wonder why in the world or is this group discussing this today in light of everything that's going on, candidly. So I think we probably had enough discussion on this today. I can't support it the way it's written. I'm supportive of doing something to address some of these financial concerns that may be sort of hindering things operationally from being able to move forward as quickly as they should. But I'd want to see a clean resolution that would do that we could vote up or down. So those are my thoughts on this after listening to this lengthy discussion. Thanks.
Okay, well, Commissioner, could I put an amendment on your motion that we just table this until we get a fully realistic assessment of everything that we need, and then take another look at it, or?
No, I had a motion. I just said I'm not going to support this. You know, I mean, if somebody wants to have a motion to table it, they can.
Okay, okay. We didn't have. I thought we had a motion.
I second what Commissioner Ellis said. That was absolutely awesome.
Commissioner Carn, please,
Haven't been recognized.
please. Now, Commissioner Ellis had the floor and Commissioner Arrington is next. Now, I am not opposed to what Commissioner Hausman has said, nor what Commissioner Ellis has said regarding the financial operations and those 10 real estate positions. So after we hear from Commissioner Arrington, we can hold it and we'll make a change to address that. Now shop it and see what you think. Commissioner Arrington?
As it relates to those 10 real estate positions, that doesn't make any sense either. It's still our building. He just said we would still be responsible for the upkeep and maintenance. So why would we transfer 10 people that are already operating the facilities and taking care of the facilities to the state and then yet remain responsible for upkeep and maintenance? Where in the world does that make sense? How much are they paying for rent? How much are they gonna pay for rent? They won't be independent. How much they gonna pay for rent? What's the square foot? What's the amount per square foot for that space that they want to occupy?
The state requires that we provide the square footage for all the places for free.
Okay, well, why would we transfer our maintenance positions and still be responsible for maintenance? Where does that make sense? How does that make sense? Why would that make sense?
You make a good argument, and Vice Chair, you make a good argument. Commissioner Ellis has made that same argument. I'm open to removing that. And I made the motion to approve.
I'm gonna make a substitute motion. I'm gonna make a substitute motion to hold.
I'll second. I second the substitute motion to hold. And we will adjust it based upon what we've heard today. And
You mean hold and revise?
Hold and revise, correct. And I will hold and revise, and I will also send each of you, and hopefully you'll read it, a copy of House Bill H-85, as well as the Fulton County resolution that was passed in 2017. So we'll be prepared.
That would be so nice.
Okay, so on the substitute motion, Commissioner Hausman to hold.
And revise, yes.
Revise. Commissioner.
Second.
Commissioner Smith, who was that?
They were trying to second something earlier.
I seconded.
Both of us.
Already moved and seconded. We're casting the vote now. Commissioner Hausman voted yes. Commissioner Ellis?
Yes.
Commissioner Morris?
Yes.
Commissioner Hall?
Yes.
Mr. Arrington?
Yes.
Arn?
Yes.
And I vote yes. We will hold and revise.
And the motion passes
All
unanimously.
right, now it is, ladies and gentlemen, it's 2 p.m. I entertain a motion to recess for lunch and executive session. We have personnel, real estate, and
Personal real estate and
litigation.
litigation.
All right, Commissioner Hausman,
Yes, until what time, please?
no, 2:45, 45 minutes. We can do it in 45 minutes.
But we call in a number in what, 10 minutes, 5 minutes?
How does that work?
Okay, hold on a second. You said until 2:40, you want to, okay,
Yeah,
that's fine.
so how do they call?
They
it?
already have a number.
They have the number?
Did everyone get a copy of the information on the executive session number?
Yes, but Commissioner Hausman was asking how much time do we have before we call into that number?
Thank you.
Okay, so let's resume at 2:45, so 2:40.
Well, no, we call in at what, 10 minutes, and then we're gonna try and be back in this meeting at 2:45. Is that what we're saying?
No, I said, let's resume at 2:45, so call in at 2:40. Did that make sense?
Okay, no, she's trying to find out, when do you want them to call to start executive session?
2:40.
And then you want, so you're gonna return to the regular meeting, not at 2:40, at 3:40? I think you could, 10 minutes to give them a chance to
10
call it.
minute break, and then we'll call in. How about that?
You gotta clear it out.
Yeah.
This, I'll be so glad we'll get back to meeting. Okay.
So what basically they're asking is, what is the start time of executive session? 2:10 or 2:15? We can't start at 2:40 because then we'll only have 5 minutes.
I was saying start the executive session right now, as soon as we recess.
Okay, well, so 2:15.
2:15, and you said,
Now they have to get it set up and we have to get lunch.
this is not complicated, John.
Okay.
Executive session at 2:15.
Thank you.
I was just trying to help you.
Thank you.
Thank you.
Test.